This evening, several items on the agenda.
Oh, it's 9. It's 9.
Is it 9?
Yes.
Okay, there it's 9. Okay. Approval of the meeting minutes from July 27th.
I would so move.
Second.
We have a motion by Commissioner Myers, second by Commissioner Kavesi to approve the meeting minutes from July 27th. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Okay, meeting minutes approved. Chairperson's report. We did have one of our SHAC meetings, State Community Health Service Advisory Committee meeting last Friday. And it was a Zoom or a virtual meeting. They had hoped that by this time we would be meeting in person, but that wasn't going to happen. We had Commissioner Malcolm, Jan Malcolm, give a heads up. She's doing an awesome job. Just keeps in my opinion, keeps a very level head, has command of the information and of her staff and all the good work that they're doing. So she presented some of the information. And I will say that their slides that they used were they sent to everybody, or was it just, did all the commissioners get them?
I got it.
I know Ken.
I sent them to Ken.
Right, and then did you?
Yeah.
I didn't look to how the chain went, but very good
Could've went to
information in the
everybody, yeah.
slides.
Yeah,
Okay.
that wasn't all the slides.
No,
that
but
was-
what they
yeah.
had prepared,
Yeah.
they forwarded, and there's a lot of information in there, a lot of statistics and a lot of percentages and cases and everything. So everybody should have received that. At the end, we had a speaker about communication, and his name is Mike Showman. I like one of his first slides, and I think this is so resonates what's going on. And the slide, and it didn't say who this quote was from, but science is not the truth. Science is finding the truth. When science changes its opinion, it didn't lie, it learned more. And I think that's what we're kind of going through. Everybody thought that the COVID situation would be well underhand, that they knew how to handle it, that the vaccines were going to do it. And well, that didn't all pan out like everybody was hoping it would. So it is science. One of the big things that's coming for Minnesota Public Health is the legislature approved a $7 million amount of money for local public health grants. And Commissioner Malcolm is tasked with how that will be distributed across the 87 counties and the tribes and agencies that deal with that, and to what purpose it's used for. But that is very unusual for the state legislature to allocate those extra dollars towards public health, other than just the traditional flat grant writing. But the speaker, Mike, it was navigating tough pandemic conversations. And it was unfortunate that a lot of things went a little long, so we didn't get a chance to really practice what he was trying to tell us. But it's part of how we're messaging this. And that does concern me, and some of the things that not Winona County did, but federal and medical experts told us, and the message has had to change considerably. And a lot of people are, it is confusing. The message has changed. And, but how do we share that with people, and how do we show them that we understand, but we need to change some of the things that we're doing and some of the messaging that's been going on. But do the slides, and we could probably put, I think we're free to put those up on our county website if somebody wanted to look at them.
If you want them there, yeah.
Yeah, I think, Marie, you thought you attended, you thought there was a lot of
Yes.
valid, good, current information there. So if we could put a link to them on the county website, I think that would be good for anybody wanting to know what the state of Minnesota is doing. Any other comment? Marie, you were zoomed in.
Yeah, I thought Commissioner Malcolm's remarks and Chris Erzman's remarks were rather pointed. Commissioner Malcolm talked about increased hospitalization and the staffing crisis for acute care. And she talked about the whole scenario as like everyone's waiting for someone else to take the lead and do something about this. Chris Ayresman said things like, everything's changed and nothing's changed. You know, I think they were, you know, rather direct about the Delta variant and what it means in our communities. So I thought that was quite interesting. Chris Ayresman said every transmission is a chance for the virus to mutate, which I hadn't really thought about. But it is, because that's the virus's job, is to survive and change so that it can survive and infect more people.
Okay, thank you. Item 4, consent business. 4.1 is approved Minnesota Department of Health Community Health Board Grant Project Agreement amendment to provide enhanced influenza vaccination coverage. That was on page 29, and then that will be included in our county board agenda. And then if we want to do them separate,
Are you looking for a motion to approve?
yes.
I will so move.
Second.
Okay, we have a motion by Commissioner Meyer, second by Commissioner Kavesi to approve 4.1. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Approved. 4.2, approve contracts with Lamar and Layton Broadcasting to support COVID-19 vaccine campaign. And that's on page 36. And again, that will be included in our county board packet. Just anybody have any questions, discussion? Commissioner Jacob.
Yeah, so they had showed where they intend to place billboards and what papers and so forth that they would run ads in. And I'm wondering, why would they not include the St. Charles paper as part of Winona County advertising? And the billboards all seem central to the city of Winona. We've certainly got I-90 running through the outskirts of the county in the rural area that would receive a high rate of viewing. And then Highway 14, St. Charles to Rochester, that seems like we would catch a lot of Winona County people there too. So I was just surprised that it seemed like it wasn't focused on the county, it was focused on the city, the advertising.
I'm not sure. Karen Sanis is on. Karen, who actually developed the plan? We
Can't hear you.
can't hear you. You're muted. Sorry.
Sorry, it was muted. Actually, Supervisor Taji had developed this with several of her staff. I don't think it is set in stone where we can place them. If the county board directs us to provide it more countywide, I'm sorry, I was not I did not, I had not seen where the billboards were going to be placed. I know Administrator Fritz had been part of this project too. So I don't think it's set in stone where they need to be placed. If you would like them more countywide and place, have one placed over towards St. Charles, I believe we could actually do that.
I would certainly like to see that.
Yeah, I don't have a problem with that. I think that'd be great.
Yeah, it should
Yeah.
be countywide.
No, and I agree. And I apologize for that. You know, I'm usually pretty sensitive to making sure that we have St. Charles and Lewiston included in everything, and not just focus on the city. So the city of Winona. So I apologize for that. Yes, we can try and amend that and to get it more spread countywide. So.
Would it be appropriate then to table this and ask for a different contract? Because this is the actual contract.
Right, and it does have the page 36 is the contract.
Yeah,
and
with
it
Lamar.
seems quite detailed as to what they were,
It's for the specific boards.
Okay, I guess if you guys would, if the county board recommends that we table it, we could do that and amend the contract. And then I'm just trying to think so we can get this out sooner rather than later.
Right.
Can we, I know there may be a planned emergency meeting for a county board meeting for the end of August yet? Would it be
Yes.
But does that-
Yeah, I mean, I'd recommend going and passing what you have tonight, and
Yeah.
then we can add on, we can get it, because we might have to have a separate contract like with St. Charles, I'm not sure, those kind of things. So it's easy enough, so we don't delay it. We want to get the message out. We already kind of lost a week or so, 2 weeks since the last meeting when we brought it up, and so we'd like to move forward with it.
Do you want to make an amendment,
Okay.
Commissioner Jenkins?
Sure, I would move to amend the proposal to include outlying areas of Winona County, such as St. Charles, I-90 corridor, Highway 14 corridor, to approve it, to approve the motion as it stands with the amendment to include greater areas of Winona County.
I would second that amendment.
Right, so we'll vote on the amendment to expand the area to cover more countywide locales. I do note, though, that billboards, sometimes they're under long contracts, and I don't know if you can get that quick turnaround. Newspapers and radio stations can do things very quick and responsive. Billboards, sometimes they're tied up for months,
Yeah, and I don't know if Lamar owns the billboards on a I-90 corridor, but
but it's
We'll
worth
figure that out.
investigating.
It also suggested which papers they were going to put it in.
Yeah, and it doesn't
St.
include
Charles and
Lewiston.
Lewiston were not in there.
Right.
yeah, right, absolutely.
And
Right.
in your neighborhood, is it Plainview?
It's not a problem to do more than what we had on the table today.
Oh, look, Mark.
Oh, okay, all right. Okay, so we'll vote on the amendment to basically to
Okay.
broaden the scope to make it more countywide,
Yes.
including those as mentioned. Okay, so all those in favor of the amendment, say aye.
Aye.
Aye, opposed nay. All right, the amendment passes. Now, Commissioner Kvesi?
Question. I think we talked about this earlier, but are all the public service announcement slots taken up, or are those no longer available to organizations like ours? Or I was just trying to get more, I'm willing to pay for this, but if we could also get some free airtime with a public service announcement.
I think it's a good idea. I think that public health can just reach, the public health educator can reach out to whoever manages those and.
Yeah, just
Yeah,
see if
they-
we
that-
have any
as
time
part- Yeah.
that we can use.
Yeah, I mean, there may be some that may be programmed out. It's hard to tell, but it's worth looking into. I know you mentioned that last time.
Well,
Okay, thank you.
with that said, we should contact MnDOT. They've got all these little message boards going up and down 52 and coming home. What were they trying to tell me the other
They
day?
annoy you?
Yes, because they're all the same and it's not a real pertinent message. It's like fill space, and you're supposed to be paying attention to the road. You're not supposed to be looking at the signs on the thing, but they put them up there.
You want us to advertise outside of Winona County? Is-
Well, so 52, yeah. Well, MnDOT, we all
Come
pay
to
for
Winona and
MnDOT
get your
services.
vaccine.
So they could put
Get it
a
in Winona.
message, they could put a message on there that's of validity to the whole state of Minnesota is my point, I guess, instead of,
I also do think that both Melanie and Ben do go on the radio,
Yeah, they do.
that's
because they
true.
tell me about it
Yeah, they do.
sometimes.
No, that's true, they do, and that's
Yeah.
really good. That helps.
Okay. So, do we have a motion to approve the contract?
So move.
I'm happy to second.
Okay. Motion made by Commissioner Olson, second by Commissioner Meyer to approve the contract. Any further discussion? All those in favor say aye.
Aye.
Opposed, nay. Okay, approved. All right. Any other business to come before the Public Health Board? This time? No general business? Then I'd entertain a motion to adjourn.
So move.
Second.
Motion made by Commissioner Olson, second by Commissioner Kvesi to adjourn. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Okay, we're adjourned. All right. Now, it being 7:01, we will call to order the Winona County Board. And we were going to rise and join for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening. Do we need some more chairs? Here, we got a couple executive chairs. They don't need to stand.
A couple extra people.
I did not notice.
Oh, I
if we
probably
can
can't
get it
get
out
through.
there. Yeah.
I can't get out.
Chris, you want the big chair?
Get this one out.
I presume
It's
that's
safe
a
here.
contingent.
Go on.
Nobody's coming in here. Here, we can get this one.
Okay.
Sorry.
If you
That's
want,
okay.
just move the band.
You want to try to do that one? Here.
Oh, geez.
Whoever sits in this one, I pay real estate tax.
Also, be lucky if it isn't the one that tips over backwards.
Yeah, be
Yeah,
careful.
be careful.
Somebody
It might be
sit in
that
it.
one.
I have the one that
Thanks,
tips
Mark.
over. Yeah. I don't know why I always get it.
Okay.
Hey, where
Mr. Anderson, are you there?
he changed his
I
name.
saw him earlier.
There he is.
Mark
there he
Anderson.
is, yeah.
Hi, folks.
The tan-
Well,
the
good
tan
evening.
man.
Yeah, look at that.
We know you're in a different time zone, so it's not bedtime yet though, right?
Well, you know how it is. After you're retired, anytime's bedtime.
Certainly all vacation time.
Yeah, well, we just want to recognize Mark Anderson was our IT director for unbelievably 22 years. It just seems like a couple. And he has retired and we never got to say goodbye or happy retirement or anything. We tried last time, but the world of technology failed us, Mark. Was that a sign? Was that a sign?
Falling apart without you.
Well, see, I wasn't even going to turn my camera on. I didn't want you to be jealous of the fine tan that I've developed.
I noticed, yeah.
Yeah, it's been pretty nice in southeast Minnesota too. So the tanning's been good here too. But we do want to say thank you. We appreciate you logging in tonight and listening, and know that we do appreciate 22 years of service, and thank you very much, and enjoy your retirement. And if you feel free to share your location with some of us, maybe we could make a trip someday.
So we're about 20 miles to the east of Naples, Florida. If you give me a call on my cell phone, I'll make sure that I hook you up with some good times here.
You're in the water.
Right. That sounds good. Okay, we'll keep an eye on the weather 20 miles east of Naples. All right.
Congratulations.
Thank you,
Thanks,
Mark.
folks.
Thanks, Mark.
Thank you.
Okay. In our agenda, where this is time for public comment, we have 2 minutes per speaker to address the Winona County Board about any particular issue that they would like to. I know there's a lot of people in the room, so if you're in the room, I need to have you come to the podium and state your name and address for the record. If you're online, you also need to be acknowledged and state your name and address for the record. So anybody would like to address the Winona County Board about anything? Oh, go ahead. We have somebody in the audience. Let's see if that's on. Do a test.
Yeah,
Is it? It's on.
is it?
Okay.
My name is Karen Riley. I live at 528 East Howard Street in Winona. I have lived here for 20 years. For as long as I can remember, I have loved and cared for and supported animals. I care about how all animals are treated, and that includes how businesses treat animals too. I know the county has given many permits to commercial dog breeders to mass produce puppies. This concerns me greatly. I saw in the local paper that the county board may be discussing more about these types of kennels and about the duty of the county, the permits, conditions, and whether or not these kennels are even in compliance, plus the impact on the animals. Many of my friends are also concerned about the breeders and the possible harm done to the adult dogs as well as to the puppies. I'm hoping that you all will continue discussing this issue and let the public know what is going on. Thank you for letting me speak.
Thank you.
Yeah.
Thanks.
Is there anyone else wishing to address the Winona County Board?
Hello.
Hello.
My name is Ann Olson, and I'm with an organization called Animal Folks. I'm here too about the agenda item for discussion of dog breeding ordinances. I urge you to continue this discussion about dog breeders in Winona County, the industry, the permits, the conditions, compliances, and most importantly, the animal. I also respectfully ask that you involve the public as much as possible. This is an issue that is important to Winona County residents and all Minnesotans. Animal Folks has conducted significant research on this industry. Just a few points. Animal limits. One condition placed on some permits pertains to limits on adult breeding dogs. It is unclear if all breeders are in compliance with this. We know of one who's not. 2 state licenses. It appears 6 Winona County breeders have a state license, which means that many do not, but we can't be sure because the Board of Animal Health doesn't provide verification of this to the public. And also mentioned was a third point in previous meetings, which is federal licenses. There are 7 Winona County breeders who have a federal license, many do not. So if a kennel, and it's a bit of a different definition than state, if a kennel has over 4 breeding females and sells wholesale at pet stores, brokers, or sight unseen, they need a federal license. We have documentation that shows many are selling to brokers and pet stores. So another question for discussion, is this a concern, violation of federal law? And then there are other state laws from sales taxes mentioned to pet lemon law to pet companion animal welfare act. These comments are about compliance, but this is such a bigger issue. We are deeply concerned about the mass production of puppies and the treatment of these animals. And we believe this issue should be discussed further. Thank you very much.
Thank you. Is there anyone else wishing to address the Winona County Board?
Chair and county board members. You have in your packet Parks and Advisory Committee meeting minutes. And it's been a very exciting couple of years with that group because incremental positive changes have been happening. And I would like to introduce Supervisor Aaron Lafee, whose efforts on that behalf have been enormous. And he's got kind of an exciting story to tell you about it. We volunteered for parks.
Thank you.
And there might be some slides too.
Good evening, Aaron.
Good evening. I'm Aaron Lafee. This is my address, 105 Cruz Avenue. I work for Winona County as a fleet building ground superintendent. And I'm here tonight to recognize the many hours volunteered by Richard Polima at Farmers Park. Over the years at Farmers Park, the stone archway entrance and other stone signage have faded and become covered in mold. Mr. Polima spent many hours restoring the stone and repairing the lettering, and he also cleaned the outside of all the lodges to make Farmers Park look beautiful. We'd like to offer Mr. Polima the certificate of appreciation for the Parks and Environment Committee and the Winona County Board. Mr. Polima.
Have the pictures? Somebody shared them with me, that it was outstanding work that you did.
Thank you very much.
I'm hoping to get Heidi to pull them up because the astonishing amount of work that he did.
Shake
there
hands one more
is
time. Let me
pretty
get that.
cool.
Yeah. Perfect.
It looks, it's just awesome. The before and the after pictures, Ann showed them to me the other day. And yeah, you do it. You're an artist.
Thank you very much.
Restoring
I
it.
appreciate it. park's been kind of in my life. for a
Oh,
while.
here it
Here
comes.
they are.
Oh, wow.
There we go.
Oh,
Tell us about what you did there.
Well, here to the left is dirty, to the right is clean. I repainted the lettering.
Hmm.
I've had the business RDP clean for about 7 years now. I was a part of the park. My dad used to be president of the park board. His name was Dave Kalima. This was back in the 80s. I can remember when the trees were this big around and now they're this big around. And for that reason, being that I know how to clean limestone, I'm in the business of cleaning things. And I drove past there different times and I reached out to Dan Lefebvre asking who I could get a hold of. And he recommended his son. I got a hold of his sons if I could go down the park and volunteer my time. And that's what we got for results. I thank you a lot for the award. It means a tremendous amount to me. I haven't gotten something like this in a long time.
But we should,
Sportsman's Club, back in the 70s, I got a youth award.
do you have any kind of, a little free advertising? Do you have any little kind of sign you can put there saying restored by?
I probably could, yep.
Well, I
Yep,
think that-
get something like that made up. And
Yeah,
yep,
I think you
my
should
next
take pride
project
in your
was
work.
To clean up the sign, and then I noticed somebody cleaned up the fire number sign. They did a really good job. And, the park looks fabulous. The STS guys did a really, really, really good job. I mean, I'm impressed with their work like you're impressed with my work. So, I mean, they trimmed along the creek and it looks just beautiful. So thanks again for the award.
Thank you.
Thank you.
Thank you very
It
much.
really
Thank
is a
you
big
very-
improvement out there.
Yeah, yeah. When you see the before and the after pictures, it really does highlight
Yeah,
the-
it's great.
how dirty they were. So, great job. All right, public comments. Is there anyone else wishing to address the Winona County Board about anything? Is there anybody on the phone that would like to make any comments? Okay, seeing none, no numbers pop up. All right, thank you very much. We'll move on. Item number 4, approval of the county board meeting minutes from August 10th, 2021.
I'll move approval.
Second.
We have a motion by Commissioner Jacob, second by Commissioner Kavesi to approve the meeting minutes from August 10th, 2021. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Okay, approved. Item 5, acknowledge receipt of the approved committee meeting minutes. And it is 5.1, the Parks and Environmental Advisory Committee from May 4th, 2021.
I'll move to acknowledge 5.1.
Second.
We have a motion by Commissioner Jacob, seconded by Commissioner Kavesi to acknowledge the receipt of the Parks and Environment Advisory Committee, May 4th. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Approved. Just a real quick, if we read the meeting minutes, it sounds like we've made more improvements at the park as far as taking down some structures that were in disrepair and improving
Yeah,
facilities.
a lot of work done out there.
Yeah, so
Yep.
thank you. It is kind of a jewel of Winona County. People should take advantage of a park like that. All right.
One quick thing,
Yes.
Madam Chair, and just to piggyback on what Commissioner Jacobs said, there have been a lot of improvements at Apple Blossom Park as well. And so a handicapped accessible picnic table, other picnic tables, trail signs, and more regularly mowed trails. So definitely look at parks.
But bring your own water to Apple Blossom. You can't get a
This is
drink.
true.
You can't get a drink. All right, moving on. Item 6, consent comments and approval of the agenda. Mr. Fritz, is there anything to change from your? No? Okay. Commissioner Kavesi,
Nothing for me.
Commissioner Meyer,
I got a committee report and a board action.
committee and board action, you said? All right. Commissioner Olson,
Nothing for me.
Commissioner Jacob,
One announcement, and one board action.
okay, and I would like to pull 7.7 for a separate vote. So we'd make that 8.0. Okay. With that change then, a motion would be in, or Attorney Sonman, did you have anything?
I have nothing, thank you.
The amended agenda, a motion to approve the amended agenda.
I will so move.
Second.
Motion made by Commissioner Meyer, second by Commissioner Kavesi to approve the amended agenda. Any further discussion? All those in favor say aye.
Aye.
Opposed, nay. Okay, approved. Mr. Fritz, would you read the items in for?
I will. Consent agenda. Department recommendation 7.1, approve fiscal year 2021-2022 cooperative agreement with the state of Minnesota to fund treatment court. 7.2, approve Minnesota Department of Health Community Health Board grant project agreement amendment to provide enhanced influenza vaccination coverage. 7.3, approve contracts with Lamar and Lighten Broadcasting to support COVID-19 vaccine campaign. 7.4, approve monthly resolution. 7.5, approve resolution to acquire right-of-way for CASA 30. 7.6, approve early order of snowplow truck in 2022 budget. And 7.7's been removed for further discussion and voting. 7.8, confirm payment of disbursements.
I'll move to approve the consent business as read.
I'll second.
A motion made by Commissioner Jacob, second by Commissioner Meyer to approve the consent business as read. Any discussion? All those in favor say aye.
Aye.
Opposed, nay. Approved. All right, general business. 8.0, which is the 7.7. To say the least, this is confusing. And there's a lot of, in the, on page 57, with the red, which I believe is all new language that was added. And it was unclear that night when this was even discussed, if this existing conditional use permit was being allowed because they already had some. And then it does say on line 4, already allows for the number of dog petitioner is proposing, so the petitioner can still continue with their plan. But this is saying that we are denying the permit, so I'm confused. What it says there, they can continue, but then we're denying the permit.
Yeah, we've already denied the permit. This is to revise the findings of fact, correct?
But it seems to be different. To me, that's considerably different than what we voted on last time. When we're saying here, already allows a number of dog
They already have,
petitioner.
Madam Chair, they already have a conditional use permit. They were asking for a second one.
But there was a whole discussion as if they even needed a second one because they had one on the parcel that exists.
That is all true.
So,
We didn't revoke the first one.
no. So they can just keep doing what they were doing plus what they were proposing to do? Or just do what they were
They can-
initially?
They can do what
How
they
many?
were permitted in their last permit.
Which is 50 dogs.
Okay.
But they probably,
and
if
it-
they
and
have the
it's-
right number, they probably ought to get the state permits.
Right, and it's very unclear, when you use, when words in a permit are said, however is to me, a very vague term. However, it's not a definitive term, and I guess when we start doing land use, which this is, zoning use, I just am uncomfortable with vague terms. However, if you want to vote on it, so really what does this action do? Just, it was already denied. So what was the intent of this coming back to us again? You didn't feel, I'm looking at Attorney Simon,
Yeah,
you did not feel it would hold up in a court of law if we were challenged, that the language had to be changed?
No, it's making sure that the findings reflect what the decision is. The findings support the decision. And Assistant County Attorney Stephanie Nuttall is online there, and she worked with Ms. Qualley after the meeting, the last meeting where you denied this, but there has to be findings in all of these numbered findings, and so these are additional findings to support the denial of the permit. So
Are we setting a precedent? I don't want to see a precedent set that we deny something and then we then we come back 2 weeks later and we micromanage the application.
It's not
and everything
micromanaging,
to-
it's
To change it.
the existing, what was before you last meeting did not have the findings because the board denied it. And so.
Right, but it was
hasn't-
also asked that we possibly table it, and then maybe, I'm looking at processes. If we would have tabled it, then this could have been done, and there could have been one vote. Now we're taking 2 votes on an issue. And Commissioner Jacobs.
This is not a vote on approving or denying. This is, the findings of fact that came before us came from the planning commissions as a recommendation to approve. So this is syncing the findings with the denial. And I will vote against this because I don't agree with that. This is not reasonably related to the overall needs of the county, and it's not in conformance with the comprehensive plan. So, I mean, that's just a difference of opinion, and I think that, we probably have a good idea how the vote's gonna go, but that's my justification for my vote.
Right, and then the last line that's in red, so long as the following conditions are met, but then it's crossed out. So is that not supposed to be in there, or what? It doesn't say the conditions.
It's meant to strike that language. So what typically happens after the planning commission or after the county board reviews a permit application and makes a decision on it, the findings of facts to the legal department are quickly typed up for either you to sign, or if it's a planning commission level, for the planning commission chair, Mark Clark, to sign. And there was a lot of information happening in a three-pack agenda, and so we were not able to get the findings out with the discussion reflective of the county board's points that night. So we just stepped back, took the notes and put it in here so that we could have it more accurately reflect the discussion that night. So that's all this is. It's not going back afterwards to try to rethink what the county board decided. It's just getting it on paper in a more cohesive manner. So that's all that we have here.
Okay, I'm still uncomfortable with the process and the way this has been handled. I think it sets a bad precedent for a person coming in to apply. That now this is in their record and they weren't really here. I don't know that they really are here to defend themselves with these things, but that's okay. I just don't want us to be setting a precedent of doing things in this fashion. So, do we have a motion to adopt the revised findings of fact?
Second.
We have a motion by Commissioner Kavesi, seconded by Commissioner Olson, to adopt the revised findings of fact for the Erickson family Shady Maple Farms interim use permit denial. Any further discussion? All those in favor say aye.
Aye.
Opposed, nay? Nay.
Nay.
Okay, passes 3-2. All right. 8.1, receive presentation from Minnesota Inter-County Association on annual legislative update. Good evening. You made the trek down from the big St. Paul. Water runs downhill.
I sure did, Madam Chair and Commissioners. Thank you for that introduction. Matt Mossman, Executive Director of the Minnesota Inter-County Association. Thank you for bringing the presentation up. And actually, I'm from Caledonia originally, so I came down early in the day and visited family, and we went out for dinner at the River City Grill, and so we spent dropped a little money in here in Winona County, and I already know it's the most beautiful part of the state, so always happy to get down here along the river and in the blufflands. So, and thank you very much for your continued support and membership in the Inter-County Association. We're a little ways off from the legislative session, so at this point we understand that you might already have a fairly good sense of some of the important things that have happened. So we like to get out and not only tell you some of the things that we worked hard on and identify some of our summary materials, but also any comments you have as we go along. At this point, we've started to turn our attention to the next legislative session as well, and so we're happy to take comments on that too. I would just say for the record, in addition to the PowerPoint, I think we have a 40-plus page summary of items that frankly we follow that just primarily relate to county business at the legislature. So it's no small task up out there, especially during a biennial budget setting session. We do not intend by any means to cover all of these 44 pages. So if we go on to the next slide, just to give some real quick highlights, obviously the state has been through a lot in as has the country and the world in the last year and a half. And, you know, from a budget deficit position of last fall, nothing smooths the way to a bipartisan agreement in the only divided legislature in the country than ending up with $1.7 billion of projected surplus and $2.8 billion of federal money available to the legislature. So what happened is they passed a $52.2 billion two-year budget, which was about a 3.4% over base, and left a fair amount of money on the bottom line for this next coming legislative session also, which we'll talk about. What also happened, however, is that many, if not most, of the contentious policy issues fell by the wayside, and we'll touch on a few of those. I'm going to start by touching on tax aids and credits on the next slide, and then Nancy Selesky and Steve Novak from our team will talk about human services and transportation. Am I running the slides? Next slide. Tax aids, you know, one thing I just want to say, you know, to Winona County and all of the counties, we went into this legislative session with a lot of goodwill because of the good work that counties did with your CARES Act money and other responses to the COVID crisis. I think that's really important to say because we fought for a disproportionately large amount and were successful at getting more of that money than was allocated to the cities and some others, which we felt like counties were in the lead on that work. And it really panned out well in terms of county program aid and other things where there was no conversation about, even when there was a deficit projected, there was nothing on the table about cutting county funding in that regard. We did not get an increase. We held harmless in county program aid, but we also got an increase of about $20 million a year in a new aid that is not general purpose. It's aimed at homeless prevention aid for youth, 24 and under is sort of the target range on teens and high schoolers. Not a ton of money. It'll be about $20,000 a year for 6 years for Winona County. That can change quite a bit. The money is actually allocated based on the number of students that your school districts in Winona County report as experiencing homelessness during the course of the school year. So that's money that historically has been collected by the Department of Education and it's being leveraged for this purpose in this new aid program. A couple things just for your constituents. Starting in 2023, business property tax will go down. The state general tax was reduced by increasing the excluded value amount from $100,000 to the first $150,000. So it'll help all businesses, but in particular, it'll help small businesses and communities. And then also just to point out, there was a lot of things that happened. There's more county, there's more money that goes to homeowner and renter refunds, but also veterans in particular will receive higher refunds because they will no longer include their veteran disability benefit payments in their definition of household income for those refunds. One of the really high priorities for the Inter-County Association was broadband. The number, we fought for $120 million. The number got as low as $30 million in some bills going into conference committee. We landed at $70 million. This will come from federal money, so we're really happy that the state will continue to put money into the state broadband program. I want to call out the frontline worker pay program because one of the really, like I said, a lot of this legislative session is about what didn't happen. There was a number of things that would have been requirements on counties and others, and one of them was a requirement that was being considered that would have required retroactive paid leave for both public and private employers back to the beginning of the COVID crisis if you were an employer who hadn't provided up to 80 hours of paid leave during the pandemic. That did not pass, but what did pass was $250 million set aside for a frontline worker pay program. It's really important because that is being discussed right now by a committee of 9 people appointed by the governor and the House that are expected to come up with recommendations by September 6th as to how to allocate that money to workers. It'll likely be primarily healthcare, long-term care workers, private sector, retail workers, and others, low-wage workers in the state. But the solution needs to be passed by the legislature. So we are anticipating a special session, not one a month, but one at least in September. And we'll come back to it in a little bit, but we're hoping there be a bonding bill that session also. That might not materialize yet, but that's one thing that we're continuing to work on for a special session in September. I'm going to stop there unless there's questions, and I'll come back up and wrap up with some things after Nancy and Steve talk.
Madam Chair, members of the board, it's always good to be in Winona County. Enjoying ourselves the last several hours here in the local area. Great drive down. Let me get right to the point on transportation and speak directly to what did happen for Minnesota across the board. The transportation funding budget bill in the end was given $200 million, mostly in one-time money. The way it was spent, I think, will do good things for the state and for Winona County. Specifically, there was an additional $14 million that was provided for local bridge replacement, county bridges, and $5.5 million for local road improvements. To put that in context, about 6 months ago in the last special session of 2020, we had $30 million for local bridges and $70 million for local roads. So combined in the last 6 months, we've had a significant investment in county roads and bridges. To put it in perspective, over about a 20-year spectrum of time, it's the most significant investment in local county roads and bridges that we've had during that period. And so I know we'll be putting it to good use. In addition, in a county like Winona, you have a lot of townships and a lot of small cities. And for the first time, maybe ever, there was significant dedicated money given to both. $12 million for town roads and $18 million for small city streets. And again, if you put that on a timeline of 20, 25 years, you would find that's the most significant specific investment in township roads and small city streets that we have.
Can I ask a question?
Sure.
It sounds like a lot of money, and we appreciate all the money it is, but at some point in time, we should say that we have X number of bridges in this program, and what's the average cost of a bridge? So you probably do half a dozen, what type of bridges do you do? And the same way with the town roads. We have, lots of miles of town roads. And again, 12 million sounds like a lot, but when you've got X number, how much is that per road? It's all in proportion to what you're looking at.
Imagine it varies greatly, but to specifically answer your questions, the money that I just described specifically goes through a program run by MnDOT with a lot of input from county engineers, city engineers, and other professionals like that. There's really, at this point, over many years, no arguing about the creation of a list of pending projects. And those projects are engineered and ready to go, but for the money. And so when this money comes through, we go directly to the top of the list, start allocating the money, the projects get built. Typically, particularly outside the metropolitan area, a lot of these bridges are smaller, and these projects are in the hundreds of thousands of dollars. But occasionally, and more frequently in the last decade, we might read an article at the end of the session about $80 million for bridges. And then when you get down to about 3 paragraphs, you find out 65 million of it is going to something like the Kellogg Avenue Bridge in St. Paul.
Big ones.
And not that much money went statewide. So under some of our selective policy changes this year, there was a $7 million per project cap put on this money so that no one big project can dominate the flow of the money and prevent it from having impact across the whole state. So we made progress not only on the money, but on the policy and tied the two together. And I think people will be pretty happy with it. And we're geared up to continue to go for more. To answer your final question, which is the number of projects, there's a lot of them, several hundred, and that are stacked up and ready to go. Bridges are probably slightly more of a crisis point than local roads, and that's being attended to also as evidenced by the allocation of money. And we continue to press that point with our legislators. And I think the last couple of years, there's some evidence that we're finally getting through to them. So we're pleased about that. The final point I want to make, because I think it solves another problem that either you or some of your colleagues have spent time on in the last 2 years since the pandemic, which is we had all of these driver's license bureaus get shut down for a variety of reasons. And so they've allocated $2.6 million for each of the next 2 years specifically to reopen all of those offices so we can better serve the public in that particular area. So as I move on, let me go to the next section of the bill, which got a lot of attention in some quarters. There was $113 million in trunk highway bonds and $30.9 million in general funds for specific projects, which is a nice way of saying earmarks. Earmarks are sort of back. No one wants to say that, but in effect, that's what's happening. Under the new term, constituent request, something that was created by Senator Newman, the chair of the Transportation Committee in the Senate, and a number of highway projects were added to the bill and specifically paid for in various ways with this one-time money, frankly, through the politicking of earmarks. But the good news is they were spread around the state and they added to the total impact of the bill. So,
but I'm sorry, are they the projects that are listed there? Chisago, Scott, or are you talking about a different list?
nope, that's part of that list.
That's I'm sorry to say, in my opinion, that's not around the state. That's pretty metro.
Which is why we've got the transportation and the local roads and bridge component for the whole thing. Unfortunately, they didn't let me write the bill. But we did our best to at least get some substantial increases for local county roads and bridges, which is our top priority.
And what is the chairman's county?
I'm sorry?
What was the chairman's county?
Well, the chairman's, let's see, he's straight west of the Twin Cities on the Senate side. On the House side, it is Representative Hornstein, which is Minneapolis, Hennepin County, and his interest is largely, I would say, largely transit, although when he gets the opportunity to write a bill, he's comprehensive in how he approaches it. And he has been responsible for some real progress in terms of state highways around the state. Corridors of Commerce, as an example, was one of Representative Hornstein's innovations back about 6-7 years ago, and that's been a pretty popular program, largely affecting greater Minnesota. So let me just touch on two final things. As was referenced by Mr. Mosman, we have a special session coming up in September where they're going to attempt to allocate substantial amounts of federal money. And there's some hope that before that special session is over, there could be action taken on a bonding. If not, next year, 2022, is a traditional bonding year, an even numbered year. And we do expect that of the few things they are able to agree on next year, a bonding bill may very well be one of those. So we have optimism there. The final point here on issues is in front of us is that federal bipartisan bill, which is now passed the Senate, is awaiting action in the House. The good news about that bill is Minnesota, for whatever combination of reasons, let's hope it was good, effective lobbying on the part of our delegation, will be a substantial benefactor from that bill. There will be a substantial amount of money going into roads and bridges, federal money from that bill if it becomes law. So we're hopeful about that. And lastly, I just want to take note of your county engineer, Dave Kramer. And I know you know he does good work, but I want to tell you that he does it with us also. I meet with our engineers every month throughout the year. We get involved in a variety of advocacy work. And Dave is always one of those members that adds something extra to the mix, and we really appreciate being able to work with him. With that, I'd be happy to answer any questions.
I'm good, thank you.
Thanks.
Thank you.
Good evening, Madam Chair and Commissioners. I'm Nancy Selesky, and I handle both public health and human services for MICA. It's a pleasure to be here this evening. This was a really good year for public health. I do have a slide. There's just we have like 8 bullets, but it's 20 pages of the summary. I just laid out for human health and human services is always large. Nothing like a pandemic to get everyone's attention as to the importance of public health. This year, they put a $15 million per biennium increase into the local public health grant, and that represents about a 30% increase. That has not happened in quite a number of years. They also put $15 million per biennium into a new public health infrastructure, $8 million per biennium into tobacco and vaping prevention, and $1.5 million over the next 3 years of an increase to the home visiting program. Finally, and I want to mention and highlight this, I know this is important to you, Madam Chair, and others, there was a proposal at one time to reduce the statewide health improvement program, the SHIP program. That did not happen. We worked hard to try to show the importance of that program. That cut did not happen.
Nancy, those first fundings you talked about, are they one-time dollars? Do they have to be approved by legislature every, so often, or are they pretty much built-in dollars to continue?
Share the local public health grant is built in, as is the new infrastructure and the vaping. The home visiting grants is 1.5 million for the next 3 years.
Okay.
After 3 years.
Okay, all right, thank you.
In terms of health and human services, one of our big priorities this year was the legislature did take care of the $8.3 million to reimburse counties for the DHS accounting error. This was related to the IMDs, the Institutions of Mental Disease. That was an error that we had no control over, and the legislature did make us whole on that one. Also, as you know, we're all doing business in a different way now with the pandemic. We're using telehealth for just about everything, or at least technology for everything. We did come forward with a waiver bill this year that contained 4 components that did pass. I'll just hit the highlights really quickly. We can use telehealth for targeted case management, min choices, reassessments. We can take MFlip applications remotely over the phone. And then the number of absent days for a person that's receiving housing support has been increased to if that person needs some sort of treatment, is in the hospital for perhaps COVID treatment, could be chemical treatment. We want to make sure that that person does have a home to return to after they're discharged from that facility. There were literally dozens of other waivers that were made permanent, which is in the telehealth article of our summary. I would just mention that you can take a look at that. Legislature also invested in mental health this year. For the next adult mental health initiatives, will receive an additional $1.75 million again for the next 3 years. They also put money, $16 million, additional capacity for grants in the adult mobile crisis services. And they created something new this year. They put $5 million in to create a children's mental health transition and support team. And this is to facilitate transition back into the community when a child is leaving a psychiatric residential treatment facility or the CABS facility in Winona, which is the Child and Adolescent Behavioral Health Hospital. That did pass as well. A couple of other things I would just mention. The legislature did provide rate increases for employees working in the ICFDD facilities. PCA's got an increase, as did other home health workers this year. Unfortunately, we did pick up one county cost shift, and this again relates to the CAPS facility in Winona. It's the Child and Adolescent Behavioral Health Hospital. When a child no longer needs that level of care, that level of hospitalization at that facility, counties will pay 100% of the charge for that until a bed is found for the child. And that is a shift to counties of $2.4 million per biennium. This is on a statewide basis, obviously, and the state can reap those savings. So that was one that we did pick up that does bring us that facility in line with the other direct care and treatment facilities. Again, we're working with the department on how do we solve the problem, but the real issue is trying to find beds for everyone. It's not that we're sitting on children in facilities. We don't want them there either. So we're working and continue to have that dialogue with the department. Another thing that the legislature did come to an agreement with was the eviction moratorium. That was also in the discussion. Under the agreement, a landlord cannot terminate or fail to renew a lease 3 months from the date of enactment. So in terms, that would be October. They cannot terminate or fail to renew a lease by then. There is an exception, and that is where a tenant materially violates the lease for something other than non-payment of rent. They destroy property, etc. The landlord does have the ability to evict that person. They do have to provide 15 days notice when they start an eviction process. So this off-ramp was intended to drive people to the Minnesota website, renthelpme.org. The state has $7 million in dollars received from Congress this year. So this is and also keep the landlord whole. So that was a good compromise that they come to agreement. I would just mention a couple of things that didn't happen. There were 3 proposals in the Senate that would have shifted costs to counties. We were able to hold that off. They dealt with capping disability waivers, freezing the choices assessments, and also putting a county share on placements of disabled individuals 18 to 27 years of age in certain settings. That did not happen. So I mentioned that. With that, I'm happy to answer any questions. I do want to just mention, I work closely with Karen Sanis from Winona, and she represents not only you does a great job with you, but counties as a whole. Just want to mention her.
Thank you.
I do have a question, Madam
Yes.
Chair. You can't answer for this, but maybe you just have some insight. So I have heard some complaining about the slowness of the distribution of that renter's money through rent help. And I wonder if the state's doing anything to address it. And I thought of anyone, you might have some kind of an idea.
Madam Chair and Commissioner Meyer, I've seen this thing. I think it's the application process. I think it's fairly unruly. I think there might be technology issues again. I think we all know that the state doesn't always do a great job in terms of technology, but I think it's, they're starting to check it out.
Okay.
It's slow.
Okay.
Compared to other states, and remember, but it's do it better in that area.
Thanks. Thank you.
Thank you.
And then, Madam Chair and members, I'll try and stick to your 2-minute drill for the rest of the slides in the interest of time. And I would just say, Commissioner Meyer, that one additional thing is if you're in the system as a renter, you've applied, you have 12 months. There was a 12-month period from the effective date of the legislation where you can't be evicted until your application is processed and completed. So we work with partners, Carly Stark, who follows corrections for us, has a commitment, not able to be with us tonight. So I just want to highlight in sort of corrections, environment, general government, just a couple of other things where we do some work and really prioritize things in our platform and had some success on also. There was an increase in Community Corrections Act and County Program Officer funding for fiscal 22 and 23. It wasn't as much as we want. It's certainly not as much as is needed, and it's certainly not getting anywhere close to the 50% commitment that the state says in statute they should be at. And we continue to push for that. Along with it was an expectation. There's a community supervision study group that's going on right now that is expected to bring back recommendations on potentially making some changes to the 3 different systems, potentially consolidating the systems, or at least changing how the money is allocated in the system, which has been a priority for the current Commissioner of Corrections. There was a push by counties, us working with AMC, and AMC was really in the lead on this, frankly, to keep the 911 telecommunications fee from decreasing and make more of that money available for PSAPs. More money wasn't made available for PSAPs. That was the good news. The bad news was the fee did also still go down. No emergency management readiness grants, which was in the bill, and then there was some money that was put in for law enforcement agencies, body cameras, and matching grants for security upgrades. And then the next slide. Actually, I'll just mention the registrars on this and leave the rest of it stand. We made some progress on something that has been going around for a while. There's certainly new technology opportunities that would that folks can get their driver's licenses renewed or plates renewed through kiosks. They don't necessarily have to have a lot of human interaction. That was finally authorized, but the important thing that had been at issue for a long time was who gets to keep the transaction fees, because it's going to be a burden for already underfunded license bureaus, and license bureaus that sponsor those kiosks will get to keep those fees. Next slide, environment. We spent more time here than we usually do with some success, trying to read the tea leaves as to where things might be possible in the legislative session also, and take advantage of those situations. And I think here's an area where that happens successfully. We did get some increase, $700,000 annually in SCORE grants. Again, not nearly enough, and we'll continue working for more, but certainly was not a priority for most legislators or the governor going in and continuing to suggest it. Close landfill investment fund monies. So some monies allocated to post-closure, more post-closure care, which is becoming an increasing challenge around the state, and also additional money in two bills for replacing rural septic systems, which is a program that counties work on. And additional funding, I think the number was $850,000 a year for invasive species. Next slide. So then I would just leave you with sort of where we at now. There was many interim studies that are in work groups that are put in place. And so we are working on a telecommunicator staff one. Carly, I know, is also working on the 911 communications one. There's the proposal on the staff one is to potentially move 911 staff from parageneral into paracorrectional, which would have cost and other implications for county governments. We are actively prepping to make a pitch for an increase in county program aid this next coming legislative session. And so that is a conversation that we will look forward to having with our board and all of you. So thank you. In closing, Commissioner Ward and Commissioner Meyer, for your service on the board and for your active participation on the board. We really appreciate your steady attendance and participation. And also to Ken and his team. I just get a lot of regular feedback, support, input that's very important to align.
Oh, he's leaving, so we've got a job open.
I'm here at the right time. So with that, happy to answer any questions on these topics or others.
Just a reminder, because I have a bunch of Wisconsin friends. We were talking about this driver's license thing, and they said now young people getting their driver's license, because it's very cumbersome to get a test scheduled and get, and with COVID, it made it very particular. They passed a law that if the agency that does the class, if the instructor signs off and the parents sign off, they don't have to go take another test with a state tester. Seems to make some sense to me. I mean, it can be pretty cumbersome for a parent and a kid to get that all coordinated, especially if the COVID restrictions.
Yeah,
and they've used kiosks for a long time,
right.
Tab renewal.
Yeah, absolutely.
Wisconsin got it right. I mean, we could learn from our neighbors.
I think that on the kiosk piece, that's the part we've sort of focused on more, because there are a number of counties that run licensing bureaus, and so these key levels and those transactions have implications for whether or not you're subsidizing with property taxes and that sort of thing. We spend less time on the driver's license itself, because that tends to be not something that counties get as directly involved in. But happy to look into it. And I think, yes, we were sort of a number of years behind when the Minlards thing started and needing to get that off the ground. And so I would say we're catching up on technology in that area.
Well, thank you for all your work. It's not an easy job working with legislators in a divided house.
We're excited to be like this.
All right. Okay. Thank you.
Thanks.
If you want to exit, we totally understand. You have a drive ahead of you.
Yeah, thank you.
Go ahead. We'll give you. We appreciate the face-to-face contact.
Yes,
Thank you.
thank you.
Thank you.
All right, moving into 8.2, provide direction to Health and Human Service Advisory Committee to collaborate with relevant partners to review juvenile preventive strategies and programs and provide recommended change to reduce potential juvenile incarceration and improve current process in 3 months to the county board.
This is
Pretty aggressive.
yeah, this came out of a couple months, well, maybe probably a month and a half, 2 months ago now.
Yeah.
A request to provide some kind of a language that would allow the board to give direction to look at that process and then bring recommendations back. Some of that's already started with the HHS Advisory Committee in conjunction with Karen's office and some of the other players in restorative justice. But this would give it kind of a formal push to get it done and get back to the county board.
I've heard some of the conversation from this, a very dedicated group of volunteers on a committee that want to try and pull the pieces together. And there's a lot of pieces and a lot of partners. So I applaud them for, attempting to bring some continuity to it.
Madam Chair.
Yes.
Yeah, I will also say, once I heard that the Juvenile Justice Subcommittee of the CJCC had started to work on mapping processes, I asked to get an invitation. So I have been attending that as well. And I like it because really this is talking about doing a collaborative effort, which is what we have and the CJCC has done for a long time. And so the general idea is that while we cannot adopt a zero youth incarceration policy, we don't really have that kind of power. We will take some action to try and reduce out-of-home placements in general. And what I was fascinated to see is that it is also potentially a cost savings to the county. So there are many benefits. It's not just the right thing to do. It will have the potential to be right for the taxpayers as well.
Yeah, the data that Karen put together in the packet, the financial data and the other data regarding cases and so forth, that was in response to, you had mentioned that, we haven't seen a lot of that data. It's not all encompassing, but it's a good vision into some of the things that we're dealing with.
It would, again, it's great information, but I have no idea how many.
Yeah.
And how many people that we're dealing with.
Right.
It's
And
big
those kind of
dollars.
things would come out of further discussions and research to figure out exactly how to look at recommendations to make improvements.
And then I think too, some clarity, because the public can see this is, what is and where is this HH shelter care and what is a DOC shelter care? Where are they? What kind of services do they provide? And what's the difference between them? I have no idea.
One of the nice things about bringing it together under the HHS Advisory Committee envelope, along with, collaboration with the CJCC, is that it is a fairly public process. There are public meetings, there's minutes, there's, all that kind of stuff. So
I would commend the staff that worked on putting this together.
Madam Chair?
Yes, Commissioner Kavesi.
Yeah, I sit on the Human Services Advisory Committee and also on the Criminal Justice Coordinating Council. So I've been attending the Juvenile Justice Work Group meetings, and it wasn't too hard to figure out that both of these groups separately were going in a similar direction in terms of the population that they seem to share. You have juvenile justice involved youth, and you have children under maltreatment or under any of the HHS programs, and they often are together. So I am really pleased to see both of those groups working together, sharing resources. I think that alone will really move the process quite quickly. So I'm pleased to see this initiative going forward.
So I would move to approve this. It's a resolution that we call it, or a.
it was just a motion.
Yeah, I would. So yeah, to move forward with this process.
Madam Chair, can I just add just a quick comment, or just maybe a quick ask that, I understand that there's a need to get this done and get this done fairly soon, but if the HHS Advisory Committee does not feel that they can have a full report ready in 3 months, could we provide you with an update in 3 months? Have Dr. Charles provide you with an update on the progress of the project, and then kind of altered timeline if needed?
An interim report might be
Yeah.
appropriate.
I would totally agree. 3 months to do this kind of work is
Yeah.
pretty aggressive, and these are volunteers.
I
They
think the
have-
intention when we put that together was that they would report their progress at that time.
Right.
So that you gave them a milestone.
Yes.
So maybe, I don't know if we had final report in there, but the idea was an interim report.
Right. I know some members of the group, they feel that they just, without a deadline, they spin their wheels and they
Yeah,
wanted.
yeah, and then we
wanted to
needed
push.
something, so that's why an interim report really makes sense.
Yeah.
Okay.
And the landscape, I have felt like when I go to the Minnesota Inter-County Association, Nancy Zaleski's report frequently boggles my mind because of all of the jargon and the multitude of programs that exist. So this is a complicated topic, and yeah, I'm trying to say we didn't get here in 3 months.
Right.
We
We
wouldn't
want summary.
We wouldn't
will-
understand a
Or
solution
you
in
could call
3
it
months.
progress report.
Yeah, we will
It
ask for
doesn't-
some type of report
Yeah.
in a 3-month time span.
Okay, I thank you for that, just because I don't want, I want the HHS Advisory Committee to be, not to feel rushed and to be able to take their time, because we really do want to represent what the community has said. And we want to take this seriously. There's been a call for action, and I think the HHS Advisory Committee has taken that call for action seriously. And I'm very, very happy to provide some leadership and assistance in this, as is Attorney Sonneman, as is DOC Director Renee Patterson. So we all want to jump in, and we all want to work together, and we really want to make this a collaborative effort. So, and we want to do it right. So I don't want them to feel rushed, and we want to be able to lead that group through this process.
So we have a motion.
Second.
By Commissioner Meyer, second by Commissioner Olson, to provide guidance to the department and the Health and Human Service Advisory Committee to work on this project and make some type of report of progress in 3 months. Any further discussion? All those in favor say aye.
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 Opposed, nay? Okay, all right, thank you. Item 8.3, receive COVID-19 public health update.
So, hi there. So just before Melanie gets ready, I just wanted to provide a quick update. The information in your packet is not the most up-to-date information, because this pandemic, it changes daily, sometimes hourly, sometimes minute by minute. We are continuing to see a lot of changes with the pandemic. Very, very kind of sad to see some of the breakthrough cases that we're seeing with the vaccine. And we will be talking about some boosters that will be coming at the end of September. We're just going to continue to work through this. The SHAC meeting on Friday was very telling of some of the issues that we're seeing with COVID, and that we're going to see with COVID moving forward. So if you haven't read that SHAC report, I strongly, strongly encourage you to do so, because it is a very, very detailed report that gives a very good story of us moving forward. And I thank you, Madam Chair, for providing that quote at the beginning of the meeting, because that is, I was going to say the same thing, is that science isn't truth, it's about finding the truth. And that was very, very telling. That has been very telling of how we have been maneuvering through this pandemic. So I want to thank Supervisor Taji for putting in all the work that she's been putting in, long hours, her and her staff. We're trying to look at some options for her and her employees to maybe spread out that work a little bit more. So hopefully we'll be able to figure out something for them soon. We thought we were going to be done with this, with the pandemic, or the work around the pandemic would lessen, and we're finding that it's not. So I want to thank her and her employees for everything they do for the county, and also Attorney Sonneman's office, and Ben Klinger, our emergency management director, has been phenomenal. I can't imagine working through this whole pandemic without any of them, and of course our administration. So I'll let Supervisor Taji provide you with her update. So thank you.
Thank you all for having me come back to provide a COVID-19 update. So the first slide you see here is a comparison of our 2020 COVID-19 cases, which is that blue line, and our 2021 COVID-19 cases, which is that orange line. The x-axis is the number of months, and the y-axis is the number of COVID-19 cases that have been reported. As you can see so far for the month of August, we are on an increasing trend. If you look at the comparison of where we are in August to where we were in mid-October, we are at the exact same moment in time. The trend across the country, the trend across the states, and the trend across our region is that the cases are up. We are seeing activity being up in our 18 to 49-year-old population, and the highest rate of cases is among our 16 to 17-year-olds. And this most recent surge that we have seen is among our unvaccinated individuals. Next slide, please. As we know, cases aren't the only thing that we should take into consideration when reviewing what the current state of the COVID-19 pandemic is within our community. We also need to look at hospitalizations. Is there a way that we can move the list of online participants over to the last?
I'm working on it.
Oh, okay. Perfect. So we can.
I wasn't just typing and texting out.
Yeah.
You were not on
We're doing it
Facebook?
over here.
Oh, my husband always is.
Right here. Let's see if she can do it.
Yeah, because of course, the most critical stuff is the stuff that's covered up.
After July 24th.
Yeah, that's
yeah.
right.
To the top.
What do the three different colored lines represent?
We've got it on
The
our.
three different colored lines represent the different
Data,
age
though.
groups.
Mm-mm.
for hospitalization.
Yeah,
Those
what she's
that
showing
are
us is more
showing
recent.
Are the hospitalization numbers throughout the pandemic. So you have that red line, which is our 65 plus population. The blue line is about 30 to 64 years of age, and then the light teal line is the younger population, so under the age of 20. What
You keep one thing, just a comment, because it's hard to follow. You keep changing your axes. So on this, the previous one you had, I think, total. Now this is rates per 100,000 population. We only have 50,000 people in Winona. So is this skewed?
This slide is for the state of Minnesota.
Okay, all right. Okay, you do say Minnesota on the top. Okay,
And the other
so
slide
it
was for Winona County.
okay, it is confusing. And again, remember the conversation at Shack? We are being bombarded by numbers and data and stuff. And so to try and have it all mean the same thing, it's difficult. No, it's not easy. Okay.
So, Madam Chair, I would like to just butt in for a second here. I would be interested to hear from the county board as to exactly which data they would like Supervisor Taji to provide. So when we started out with this presentation for this agenda, we had 53 slides and we cut it down significantly. And it would be really nice to know exactly what information the county board wants to know. What is the most important to you? And so if you could send even an email to myself and Supervisor Taji after the county board meeting or within the next week or two, so we can give you the information that you really want to know.
Okay. We can do that.
That would be greatly appreciated.
Okay. Thank you.
What this slide basically shows is that hospitalizations are up. We do have one of our medical providers present in the audience. And I don't know if you're comfortable with me speaking to what we're seeing, but we are hearing from our local medical providers such as Henderson Health, Mayo Clinic, that they are at capacity either with resources or staffing. They are at diversion, which means individuals coming into their hospitals are being reallocated elsewhere. So I know that was a talking point that was discussed last time we met about if we're at that point. We are at that point. We're at the point where we were at October of last year, which led us to that November surge.
Madam Chair.
Yes.
Yeah. Yes, I would be interested in hearing that. We can do that afterwards or we can do it now. I think what I'm trying to understand during our conversation last time, one of the important issues was the idea that the healthcare system might get overrun because of cases. And so it's important for me to understand where are we at regionally? Where are we at from a statewide? And because I have been told that that here in Winona Health, we don't really keep the patients that come in with COVID. We send them on regionally. So how are we doing regionally?
So I can't speak to Winona Health, but I can speak to Gunderson Health System, both
Great.
in La Crosse, our critical access hospitals, as well as my campus here in Winona. Volumes are on the rise across the board. COVID positives are certainly on the rise. I think we're being inundated with patients and we're struggling to keep up. I know that there have been a lot of positives coming through our doors here in Winona, just like La Crosse. And like I said, we're really struggling at this point. There have been multiple occasions recently where we have struggled to find placement for patients because our main campus in La Crosse has been on diversion, just like many others in the region. I can share that personally, not last Friday, but the Friday prior, I made multiple phone calls for my urgent care team to try to find placement for patients and was told time after time that they were on diversion and could not accept.
So what kind of treatment, and I've heard again, you hear all this stuff. What kind of treatment are these people needing at this point now? Are we still talking ventilators and everything? Or what are we doing for treatment?
So for treatment of COVID, we are.
Ma'am, could you step a little closer to the microphone?
Sure.
Thank you.
So for treatment of COVID, if they come in with COVID, we're sending them to our main campus for perhaps monoclonal antibody treatment or treatment into our critical care unit, depending on how sick they actually are. But we are at the point where we are struggling to place individuals who don't have COVID that just simply need to be hospitalized for other reasons because we're at max capacity. I can speak to my urgent care here in Winona, and we have surpassed our projections, and we have actually hit record numbers twice in the last 2 weeks, which is a good thing for us. We want to be busy, but it's a very scary thing when we hit those numbers and we're not sure what we're going to do to treat those patients.
And do you know, I've also read and heard that the workforce is down. We've had retirements, people have elected to leave the workforce. And so are you experiencing, if you're fully staffed, would you still be, or are you down employees?
Yes, I think we're experiencing shortages across the organization.
Also in the SHAC meeting, Commissioner Malcolm talked about a study of staff in relation to mental health issues. Are you finding any issues along those lines, or are you doing any special treatment to prevent those things? Or
yes, we do. Our organization offers EAP, so we always have someone there that we can talk to in the event that we feel that we need to. But I can see it on my staff's faces. They are stressed. They're worried about what this looks like. With the numbers, the data being presented to us and the numbers rising so quickly again, I think, we felt a little bit of a reprieve in June and July, just to turn this direction so quickly. It's scary.
they were presenting it at the SHAC meeting. It's kind of like, well, here we are again, and this was these cases are preventable mostly. And here's our frontline staff being, pushed out right again to give. So that was where the concerns were.
Commissioner Jacob, question.
Yeah, so when you talk about being full or at capacity, for me to better understand this, if just, for instance, if we were not in a pandemic at all, how full does a hospital or a facility usually stay? Are they like 20% full, 50% full, 70% full? Where would you normally be if you were not in the midst of a pandemic?
Good question. We are at capacity when we're near 300. And usually we float around I'd say 220 to 250 on a heavy day. And right now we're very close to 300 every single day.
So no pandemic, you're 75, 80% full? Okay, and now you're at close to 90 to.
Yeah.
Can I ask just one of the things we talk about is it's hard for me to understand because I don't really have a chart or something, is you're talking about like 300 beds at the main campus?
Yeah.
Okay, so and you don't have any of those kind of beds in Winona, right? So that's more the regional aspect. We've got obviously your organization in La Crosse, but then there's, you know, Mayo and Olmsted, and we have to look at all those. So do we have, I guess, do we have an idea of, like, for instance, Winona Health right here? They only have a few beds, or, you know, a lot less than 300 obviously here. What are they doing? Yeah, I saw her there and I thought I'd, you know.
But Gunderson's service area is heavily western Wisconsin. I mean, it's a western Wisconsin facility, so, you know, it is a region, but it's, you know, it's very Wisconsin orientated.
Yeah, it's hard to get and I think Rochelle can add some light to it because they have diversion under different characteristics, you know, it depends on what it is and what their ability is at that hospital and all the things we talked about.
Thank you. So just to clarify, we do not transfer all of our patients out that are COVID positive. In the last couple of weeks, we've had maybe a half a dozen patients that have been hospitalized. I think of that, only one was transferred, and it was due to comorbidities and sort of a critical level of care that was needed. So we are seeing the same things that were just discussed. So COVID's on the rise, lots of people coming in. We have a testing site and a vaccination site. We're probably doing 250 tests a day. Positivity rate from 10% to 18% or so. We are seeing the breakthroughs, happen. Most of the patients that have been hospitalized are people who have been unvaccinated, although we have had 2 that were vaccinated. But COVID wasn't the reason for their vaccination. I would tell you that around the state of Minnesota, the same issue, hospitals, I would primarily due to workforce. When we think about last year where the capacity was for hospitals, it has shifted down, and it is a workforce issue. Lots of people have left for all different kinds of reasons. And so in Minnesota, we have a program called the C4, which is a coordination. It's a service basically that any hospital in the state can contact and say, we have somebody who needs to be placed. We have had hospitals in Minnesota send patients to North Dakota because there's not a bed open in Minnesota. We have outpatients that have come down here that we're treating because there's only one location up in the Twin Cities for some of the outpatient treatment that they need, and we can provide it here. That's a long way for some of these folks to go. But there is a whole network across Minnesota that's sort of working together to deal with, the issues that are out there. So while we have a lot of outpatients, that we do the treatments for, that's, I think, going well. We're just trying to keep our ears to the ground in terms of, where are these numbers going in terms of the increases. Lots of the hospitals are not filled with COVID. They're filled with people who have delayed care from last year. Okay, so things get exacerbated, they come in, things like that. There are some hospitals in Minnesota that are also now kind of dialing back on their surgeries because they need the inpatient beds. We haven't been doing that, but kind of keeping our eyes open as far as that goes as well. So, we probably have another month of the surge going on here. Just sort of depends on people's, behaviors with masking and, potentially vaccination, things like that. So we are on the lower side with our county in terms of overall vaccination rates, just over 50%. That certainly would help. It does keep people out of the hospital. And the last thing I will mention is our area nursing homes that's an area that can also cause backlog that goes into the hospitals where there's no place to send people. So our nursing homes are also struggling on the workforce side really significantly. So that brings that capacity down, and all of the area nursing homes have brought their beds down because that's what they can staff. So there isn't a lot of places then to send people who are waiting to be discharged from the hospital. So we've got a kind of a spiraling issue right now.
So our previous speakers, the legislature lobbyists, they said there was money allocated for frontline workers. Is that something that Winona Health is going to benefit from? I mean, I didn't understand in their quick.
It's money that was just set aside. That's not really money for. It would be like a hero's bonus.
Yeah, right.
And it might be $300 to $500. It just depends on how many people they decide are going to get it and things like that. So that's not going to help in that regard. No.
Okay. All right.
Can I ask another question? one thing that puzzled me when you look at the data is that what Melanie said was we have the 18 to, I think it was 39, or maybe it was 40 something, that two brackets really with a lot of our cases. Yet we're struggling with hospitalization. And if that's the same, you said it was reflected throughout the state, that same group. They're mostly unvaccinated is what you're saying. That age group's mostly unvaccinated, and that's why they're having the severity of the illness, even though they're in a younger group. But they are able, most likely, to tolerate it more. But that doesn't mean they wouldn't necessarily be hospitalized at a higher rate.
I would, well, of all of the people who have been testing positive, there haven't been that many hospitalizations, but I will tell you that the people who are being hospitalized are very sick.
And they're usually unvaccinated.
And they're usually unvaccinated.
Yeah, that's consistent with what I've heard. So.
And we have had from babies to 90-year-olds that have been tested positive. So we are seeing a lot more of the younger.
So earlier there was a big push on tracing. So are we knowing where these people are going or coming from?
At this point, it's just community transmissibility. I think with the Delta variant, it goes so fast and it gets hard. I would say that we're seeing a lot of families coming in. So like wherever one person picks it up, we're seeing a lot of families coming in for testing and a lot of positives that way as well. So,
So you can't say, you can't say Sturgis caused this uptick. We don't know. We don't know. Okay, we just don't know. Okay, I mean, because there were a lot of fingers pointed at gatherings like that. That were going to be the cause, and it could be.
And we watch a lot of things. I mean, actually for the arts, we sort of watch, but we watch it with time and just kind of see that is that a correlation? I mean, I think that's hard. Those will be assumptions.
Yeah, so I feel like I should fully understand this, and I don't think I do yet. Does the vaccine prevent? So I read a study here recently that the vaccine does not prevent people from getting the virus, and they can still be carriers without knowing it. So does the vaccine prevent you from getting COVID, or does it not?
It can prevent you from getting COVID, but you can also carry the virus and pass it on. You can shed it. Okay, so you may not actually be sick from it, but you could potentially shed that. I think what we're seeing right now is we went through a nice stretch where we were at like 1% positivity for a lot of months because of, where the vaccine was, lots of people were getting it, masking, all of those things. The Delta variant is a different ballgame. And what we're also seeing is that vaccine is still effective. It's less effective with the Delta variant. And so that's where we're seeing some of that breakthrough, that it works really with more of the alpha side, if you will, the early viruses that we have, but the Delta variant is different. So maybe not quite as effective. So the goal right now is to be vaccinated is that you don't get severely ill and you don't get hospitalized. That's kind of the goal right now.
Okay, I think I understood that it does do that, but I think a lot of people before they signed up for the vaccine thought that it would prevent them from
being was the one vaccine that actually you didn't have the ability to spread it, if you will. But the other ones, you potentially could carry some vaccine, and you could be. Now, I don't want it to be misunderstood that everybody's walking around that was vaccinated is infecting people. I don't think that's the case at all. But it is possible that you could have picked it up from somebody. You might not get sick, but it could be shed.
Madam Chair? Yeah, so just to clarify, the way that I understood this is that perhaps with the alpha variant, I had the Moderna shot and that's 94% effective. But against the Delta variant, that might be only 60%.
I'm not sure what the number is, but it's probably
So,
less than 90.
so I do have some protection,
Yes.
but it is not as high a percentage as it was against the original variant. Okay.
That's what is being.
So with all these tests, these 200 and some plus tests you're doing, are you able to tell, because we seem to be mixing the words, COVID-19, but now we got Delta. So Delta is the scary stuff that everybody's, worried about now. So can you tell?
Every positive test is sent up to MDH and is genotyped, or is it the variant or not? And so we don't know here ourselves. We don't test for that. We just test PCR if they're positive or not. All positives are sent to the state. All of those are being tested and genotyped for the variant. And I
believe, I'm not sure what the exact number is, but we're over 90% of it is the Delta variant.
Okay, but now, maybe I'm getting ahead of myself.
And that's still COVID. It's just a mutation.
Right, but they didn't design the vaccine for the mutation. That's the problem. That's why every year you push different flu vaccinations because they've designed it for what they think is coming. So maybe it's just a flaw in our, and it takes time to develop these vaccines. So will the next
no question.
vaccine?
I mean, I think, we all have
And these
front row seats on
boosters.
this, rolling out situation of what COVID is, what this virus is, the vaccines. I mean, we're seeing real time this whole thing, play out. So certainly as the Delta variant has spread, as there's a lot more knowledge, a lot more data with that, then they have been able to do studies, learn what's happening with that, whether the vaccine works or doesn't work. I mean, like we're getting this real time. It does change like every day, just like these graphs, what we're learning.
So a lot of people, there's a lot of information coming out now. Everybody's going to have to get a booster within so many. So is this booster going to be something different to counteract
It's the same vaccine.
Okay, so, and you just said the same vaccine isn't as good against the Delta as the regular.
Right, and so I'm not the scientist in that, but
Yep,
what they are saying
yep,
is
I know
that,
you're not.
what you're doing is you're charging up the antibodies, right? And so the booster is giving you more antibodies. So it appears that it's sort of over time, so 8 months later, and with the Delta variant, your antibodies may be lower, so the booster is going to give you the boost of the antibodies.
I've been asked, is there a simple test to know if you have the antibodies and what degree you have?
Antibody testing, you can come in and find out if you have the antibodies. You should have them if you've either had COVID or if you've had the vaccine, but you can get tested if.
But is there, and I don't know, is there a number, like you need 10 antibodies to be good, or is 2 antibodies good, or how do they measure?
It doesn't work like that. It's, I don't know if you know what that is, but there's like a ratio thing that comes out and you're on one side of the line or the other side of the line, but it
Okay.
yeah.
Okay, all right. I know you're not the scientist and you're not the vaccinating coordinator, but thank you for your information.
Thank you so much for coming tonight.
Don't leave yet.
Yeah.
Don't leave yet.
Nice.
We're surviving up there.
Okay, so,
Thank you, Rochelle. So if we go to the next slide.
yeah, let's keep working through this. Please.
So this slide presents where we are today. As of today, there are 81 new cases reported. Well, 53 on August 24th and 28 on August 22nd, for a total of 5,204 cases in Winona County since March 25th of 2020. Our 14-day case rate for the county is 64 cases per 10,000 Winona County residents. The metric that the Minnesota Department of Health and Center for Disease Control is using to determine what our risk is the 7-day case growth rate, which is 392 COVID-19 cases per 100,000 Winona County residents. The Winona County is in high level of transmission and has.
What's the number between the different categories?
So
what's low and I can't remember the name.
So there's low, moderate, and substantial.
Right.
To be substantial, you have to have at least 50 cases per 100,000 residents, and 100 plus puts you into high risk.
And we're way over that.
We are way over that. And across the state, we're 70% more than where we were last year at this time.
But I think we're not alone in the state. I mean, I think there's only one county way up north that might be lower. I mean, that's not red, some of the maps I looked at.
The majority of the state is red.
Yeah, so I mean, and is that true of our Iowa border, Wisconsin border, North and South Dakota borders?
From what I've seen, the bordering counties are red as well.
Okay, all right.
Next slide, please. Next slide, please. Great, thank you. So this is the vaccination rate that I was mentioning. Of our total population, which includes individuals that are currently not eligible for the vaccine, we're at 54%, receiving 1 dose. Of those currently eligible, which is 12 plus, we're at 61%. The goal for herd immunity is 70%. We are seeing a vaccine increase for those receiving the vaccine, and with the FDA approving the Pfizer vaccine for individuals 16 plus fully, we anticipate more individuals getting vaccine, but time will tell. Next slide, please.
Question on the vaccinations. Have we seen an upsurge in vaccinations over the last week? And I may be too soon to tell, but did we see an upsurge since yesterday when the Pfizer was fully approved?
We have been seeing an increase in general, but we'll see if there's a surge probably by the end of this week. Absolutely. So this slide specifically shows race and ethnicity by COVID-19 vaccination rate. This was a question that was posed the last time we met. You can see the percentage of the different races and ethnicities that have been offered at least one dose of the vaccine.
And this is at the state,
This is across the state.
not Winona County. Okay.
Correct. I do have the information for Winona County, but it was one of the slides that I removed from the presentation. Next slide, please. This is the 7-day case growth and the positivity rate for Winona County. So these are the two measures that the CDC and NVH uses to determine which COVID-19 threshold we are at. So what this slide shows is the y-axis is the different weeks that we've been looking at. So we have data from July 18th of this year. And then the x-axis is the number of cases or percentage. So blue is the 7-day case growth per 100,000 Winona County residents, and then the orange is positivity rate. You can see the blue has been increasing. So for this, we're at 263 cases per 100,000 and at 8% positivity rate. That 7-day case growth is what putting us in the high risk. And as you can see, anything over 50 cases per 100,000 puts you in substantial, anything over 100. So there's been, puts you into high risk. We've been 2 weeks in high risk.
So what date did the students start showing up on our college campuses?
August 17th, they were.
Okay.
So that-
Most likely be a surge, 2 weeks depending on behavior.
263 is not, is a fraction of, a point fraction of 100,000. So 8% is, 8% is.
What is the 8? What are those
The 8%
percentages?
is the positivity rate. So the number of
Positive, I mean, the general public looking at that is going to assume that 8% of the people have COVID, and that's not, that's not true, right?
No, that's not right.
No, that's 8% of the individuals seeking out testing are testing positive.
That's just the way that the CDC is it the CDC that has, this is how they make the judgment about where you fall.
263 out of 100,000 is like 0.0 something, 0.0.
So this is how many cases. So if we had 100,000 people in one room, and let's say we're all gray dots, 263 of those people would be orange dots, meaning that they were COVID-19 positive. So that just means if we break the population down to that number, there's going to be 263 people who are positive if there's a room of 100,000 people.
Can you tell me what percentage that is of people are actually positive?
I think Ken's got a calculator.
Sure, put a lot of pressure on me.
Sorry, thank you.
You want the, okay, so take
I'm not
100.
so good with math.
It's 0.26%.
Well, 1,000 people would be 1% of 100,000. So 263 would be, yeah, 1/4 of 1%. Test positive.
Right.
So 8% are testing positive. It's 2
Out of the people you're testing,
Yes. Right. Yeah, but we're seeing testing increase as well.
0.25% of the population is testing positive out of 100,000.
8% is testing positive. The 263 cases is the number of cases being positive when they're among 100,000 Winona County residents.
8% of the people you're checking,
Correct. That is seeking that test.
okay, but not 8% of
No.
population.
Correct.
Point,
And then-
0.25% of the population.
Right. And when you say test positive, but that also is people who are asymptomatic or maybe have a slight aches and chills.
Could.
The range of seriousness is not taken into account. It's just a matter of, okay, if they test positive, you're in that statistic. Okay.
With the Delta variant, the fact that 8% are testing positive means that 8% are also have the capacity to pass it on.
Correct, if they're not adhering to quarantine or isolation. And this is higher, because if we go back to June and July, we were at 0% positivity rate. So the amount that it's changed in a relatively short amount of time is concerning. Next slide. So we talked a little bit last time about hospitalizations and what the capacity was. So thank you for being here today. But there's public health and healthcare work together on many things. But public health, we are very preventative, proactive. We're trying to stop from getting us to that November surge that we experienced last year. Healthcare is reactive. They're treating COVID-19 patients. So the whole goal of providing this information and promoting public health is to be proactive and try to mitigate the further spread of COVID-19. So next slide, please. Again, I'm posing some possible actions that we can take that we discussed last time we met. Is option 1 is no changes. 2, Winona County did, as of yesterday, say all Winona County employees must wear masks or face coverings in county buildings as of yesterday. We could also do option 2, where employees and visitors are required to wear masks, or do option 3, which is implement a countywide mask mandate. I know there were some questions about mask effectiveness, which I do have a variety of different literature resources on the last slide of this presentation that have meta-analysis of all the current literature that's out there that do say masks are effective. I just wanted to present this for you for possible actions we could take today.
I do have a question, Madam Chair.
Commissioner Meyer?
Yeah, so the mask decision that the county made for its own buildings does not include visitors to the building?
No, it does. The only direction we gave employees, because of,
Oh, you don't try to enforce it?
well,
Yeah.
yeah, because we don't want a confrontation or
Yeah, that's fine. Yeah,
affect
okay.
employee safety.
Great. Okay.
But the
Yeah,
door,
but
if you look on the doors, it
Yeah.
says mask required.
That's what I thought. Okay.
And you have a box available.
Yeah, we have masks available. It's just, we don't want confrontations.
So you have information on the effectiveness of masks. I would think that we're 18 months into this pandemic, that there would be just really empirical proof of places that did not use masks and a massive spread of the disease, and places that did mandate masks and no spread of the disease. I mean, there should be after 18 months, there should just be a plethora of that information available, and no one's bringing that to me.
That is a good point. Those studies could still be ongoing, but I can take a deeper dive to see if there's anything like that out there. I have not heard of anything like that quite yet, but it could be.
And we've got real world experience at this point, 18 months into it.
Madam Chair?
Madam Chair.
Any other things, Commissioner Jacob?
No.
Commissioner
I
Vesey?
can give you a resource that says, here are 49 scientific studies that explain why masks work. And they even, they're all by dates, so you can tell which ones have applied to the Delta variant and which ones applied to just general mask wearing at the beginning of the pandemic. They're all peer reviewed, and they also included a list of retracted and disputed claims, because there were some studies that came up with interpretations that have now been withdrawn, either because of the statistical processes they used or interpretation or whatever. So
I don't want to get into it.
no, I know, but this is 49 studies.
I can tell you, I've got constituents who will give you all kinds of information on the opposite side and the dangers of masks. And And so, I mean, that's for us to sort through collectively. I just thought 18 months into this pandemic, there should be very clear proof of here's the areas that have been mandating masks and how effective it's been, and here's the areas that have not. And you know, I'm seeing a lot of evidence and points just the opposite. Areas that have not mandated or used masks at all and are low transmission rates. So
One thing I have found is that as you look at different studies, one thing that's important is the, not the reputation, but the rigor of the site itself as they collect this information. And I have found people referred me to sites that had conclusions, and when I looked at the rigor of the site that collected that information, it was not as rigorous as, say, the CDC or peer reviewed or those kinds of qualifications or criteria. So you need to look not only at the study, but at the rigorous, at the site that collected the studies. How did they interpret them, and are they being accurate?
Well, so
Madam Chair?
what do we, you've brought some options forward. Our administration has, is enforcing or recommending or doing the plan that we're following. Everything that I have been seeing is the CDC is recommending. Most all the public health, Minnesota Department of Public Health says recommending. What happened to the social distancing, and then where is the, so it seems like there's a real emphasis on masks here in the community, and it's become, and I hate to say it, it's become very political. I've heard some horror stories of school boards being confronted because we're all concerned about the youth, the children. We're doing, so where did the 6-foot social distancing and what were some of the other things? And where's our emphasis on vaccination? It seems like every page or every turn is, we're just really pushing masks. And it is an antagonistic approach because we have such a divide within our, what's that?
Yeah, Madam Chair, this is Karen Zanis. I would just like to make a statement in regards to that. What we are tasked as a community health board, and I as public health, and Attorney Solomon as my legal counsel, we are tasked through Statute 145A to protect the community from to slow the spread of a communicable disease. And yes, you are absolutely correct. This has become, masks have entered the political arena, and unfortunately it is overseeing what we are trying to do. What we are trying to do is mitigation strategies to slow the spread of a communicable disease, regardless of it being COVID or the flu or any other pandemic. And one of those mitigation strategies is masking, and that has entered the political arena, which if we make decisions based on the political arena, we don't necessarily, or the opinions of those in the political arena, we don't always make a decision that is based on what is best for the community. I also want to state that mitigation strategies are one thing and one thing only. They are non-pharmaceutical interventions to slow the spread of a communicable disease. That's masking, that is 6-foot distancing, that is hand washing, that is vaccinations. Obviously vaccinations is a pharmaceutical intervention, but that is all in there. I've gone back and reviewed all the information that we've provided to the community as a public health agency since the August 10th county board meeting. And everything that we have put out, 90% of it is based on vaccinations. Everybody getting your vaccinations. There's very little information out there. The only other information that was put out there from my department was a quote in the newspaper from Supervisor Taji, but she made it very clear that she was talking about masking as a recommendation by the CDC. So that is what we are trying to message out there as much as possible as vaccines at the local level. We only have control over what happens at the local level. So I just really want us to focus on what our jobs here are at the local level and kind of take this larger political arena kind of out of the picture, and be able to do what we need to do and what is necessary for the health and safety of our community. We as government are here to serve.
I think we all take
Yep.
this very seriously.
Yeah,
I've been
yeah.
engaged in public health for years, but it has to be, citizens have to want to protect and want to do. And I think sometimes and again, I'm going back to the communication of this is when I was told when I went and got my vaccinations, the second one, I was good to go. And I believed them. I was good to go. And a lot of people have been told that. You get vaccinated, you're good to go. Now we know that's not true. So it's very important, the message and how we send the message and how we get people to comply with it voluntarily as a recommendation. We're doing everything we can. We've got more vaccination clinics scheduled. You went to the county fair, you went to Goodview Days, you're going to Gladiola Days. We're making it available. I see new signage at Winona Health. People, if they want to get tested, we are being very proactive in our actions, and we're taking this seriously. It's not that we're not taking it seriously, but we do live in the political world, and we've got a big divide, not only in Winona County, but in the country and in the world. So I think to get people to want to do it is important. And I don't think the county board has sent any message saying we don't want to get.
No, and I'm not saying that. I'm not saying that in any way, shape, or form, Madam Chair. What I'm saying is that we as government are put here to serve the people, and we are put here to serve the people until it is time to protect them. Then when we need to protect them, we protect them, and we need to determine at what tipping point do we have to intervene and protect them. So that is all I'm providing you, and that's really what I wanted to say. I've never, ever accused the county board of not taking this seriously. Please know, yeah, I believe you guys are partners along with us this whole way. And I've appreciated the support and the outreach we've received from every single one of you as commissioners. So please don't think that I've ever thought you guys weren't taking this seriously. It is just, I'm really trying to focus on what our goal is and what our duty is as government. So thank you.
Madam Chair.
Commissioner Meyer, thank you.
So one of the resources that is on the following slide, I printed this particular article off, and it is actually sort of an analysis of all kinds of other issues. It's a comprehensive review of the evidence regarding public health, symptomology, transmission, mask wearing, and reinfection. And in particular, there's a good 15 pages of very small print devoted to the nuance and the difficulty of the issue related to mask wearing. And it was hard to read, and there's a lot of information in there. But ultimately, the bottom line is that the benefits outweigh the potential harms, especially when there is widespread community transmission. So and that the benefit is the most effective in indoor settings. So there are certain situations where it's marginal or it doesn't make any sense. And it does matter what is the kind of mask, what people have available, whether people wash them at home or they get washed at the hospital in a professional washing machine that is at a very high temperature. I mean, there's just a lot of different variables to all of it. I would like to, based on the email that the county attorney sent to us, I would like to pursue the option of implementing a county mask mandate. According to county attorney's note, we would have the authority to do so under 145A, that's the state statute, through our community health board. But we would have to make a change to the ordinance that would require us to write up the request. It would have to be noticed, and that would have to take us at least 10 days, and then there would be a public hearing. I think that that makes good sense. I do think that this is a public safety issue. I would not go as far as trying to mandate vaccines. I think that's kind of probably above my pay grade, but I do want to try and help folks, in particular, when we're still at a time where kids under 12 can't be vaccinated, we're putting them at risk. And I think at our last meeting, Commissioner Jacobs said something like, well, if people have made a choice not to get vaccinated, that's their business. And I agree. I think there's a point where it does affect all the rest of us. And so I want us to do everything we can to encourage people to get vaccinated. But once we're able to get our kids vaccinated, because they're actually eligible, and about when do we expect that would be?
Pfizer could be September, October, Moderna by the end of the year.
Yeah, so it's a few months. I would like to extend that as an opportunity for us to do until that's possible.
Madam Chair.
Commissioner Jacob, did you have something?
Well, yeah, when it comes to the county taking on this kind of a mask mandate countywide, I think I mentioned it at the last meeting, they could do it at the federal level, they could do it at the state level, each city could do it. If the city of Winona wants to do it, they can, but for the commissioners sitting here to mandate Goodview and St. Charles and Elba, I mean, those cities, this should be managed on a, case by case, city by city. If there's an outbreak, that should be up to that particular city. For us to just come up with a one-size-fits-all solution for the entire county, I can't support that.
Well, I mean,
These cities already can do it. All these cities can.
I did talk to several city administrators that I know of. You were at the Goodview City Council meeting.
Right, and Mr. Klinger was also.
And Dan Mateka is here, so.
And they have the power to
Right,
to do
I
it.
think there's an issue of feeling that if they do it and we don't do it countywide, it's less effective.
But then they're in control. See, I agree. To do a countywide mandate, so that takes away individual responsibility and individual choice. City Winona can do it. That's the hub that, again, in your statistics, are we seeing that as a hot spot, the city of Winona? Or is it unincorporated downtown Nodine? I don't know. I don't know that your statistics show that. Of course, there's more people. So all the cities can do it. The universities have all taken actions to do their thing, the people that they're responsible for. I think the school board is 861. I'm not sure about the other. We have more than one school board in our community. I'm not sure if
When I talked to
St.
Nick
Charles-
Coverman, he said that, well, he lives in Lewiston.
He
said
lives
that
in Lewiston and he
They had
supervises. No. So I mean, there again, they're in charge of their environment. I think we've been very proactive in redoing our county buildings. And we offer the service and we offer the mask and we offer if people need to have services and aren't comfortable coming in. I just think a mandate today with the information that the general public has received is going to be very negative. And I think we want it to be a positive. So if we highly recommend that you do this, and believe me, when I go see my grandkids, I put on a mask because my kids want me to put a mask on. If I'm going into a store that says, please put a mask on, I'll comply. They're in control of their destiny. I've had a number of businesses say they really don't want to go through this again. If they feel the need to do it in their individual business, they will and ask their customers to comply. If our borders aren't doing this, Rochester, Olmsted County is not doing a mask mandate. Believe me, you talk about economic development, business base, tax base, people will go shopping in Rochester. Again, they have a choice, or they'll go to La Crosse because there's not a mandate there. each individual business. So I think we have to be careful and putting it in a negative tone. And to me, when you say mandate, that's very negative. And I don't like to be in a negative situation. I would say we highly encourage people to wear masks. We highly encourage people to get vaccinated. We highly encourage them to wash their hands and be socially responsible and individually responsible. But to just say, we're going to mandate this, I think you're going to have potential, and I think even Attorney Sonman would admit there is a potential for litigation on mandates. Our society just is not ready for mandates. Commissioner Jacob.
Well, yeah, and we would be exactly following the guidelines that are put out by the CDC. It says specifically in our packet has responded with guidelines recommending masking. We're saying recommend it, but not mask it, which is exactly what the CDC is saying, and we'd be exactly in step with that. But, you know, we've got cities in my district where you're going to put a line right up the middle of the city of Minneska, half on Wabasha County, half on Winona County. Rolling Stone, Bethany, Altura, Elba, Stockton, Utica, all in my district, and you're going to take away their ability to manage their own government. They have a right to determine whether they want to implement something like that and when it's appropriate to do it.
Madam Chair,
Commissioner Kavesi.
thank you. The one difference that we're talking about here is that the county actually has the public health responsibility. We are charged with that officially of prevention. That's what the slides showed. I think the SHAC meeting, I'm going back to that. I mean, Commissioner Malcolm said the Delta is a new variant. It's a new game. Okay, and she went all the way through, you know, some of the discussion of the dissension, and you can't please everybody, and some are asking for stronger protections, and what would that be? But she also said that the CDC, when they recommend that right now, that means they're recommending that locals make the decisions and make the mandates. We have that public health responsibility. And I think one reason we're focusing on masks is as part of that, one of the slides last time was a Swiss cheese slide. And it's showing that there's an additive effect. If you just do vaccinations, that would probably be one of the best things to do. But if you do vaccinations, masks, social distancing, hand hygiene, ventilation, outdoor meetings, all of those other pieces of it, then you have an additive effect of prevention. You're boosting your prevention. So that's why we're focusing on masks. We're not pulling it out and saying that's the only piece that's important. We're saying in addition to these other measures, which people are doing. So that's, for that reason, I can also sponsor or get behind the steps that we need to take to deal with a county-wide mask mandate.
I got a question for Karen. So tonight, we can take action to take further action, but we can't actually introduce a mandate tonight.
It's, as I indicated in my email to you, and this was in response to a question that Commissioner Ward or Chair Ward had said about the resolution, which is the next item on your agenda, which is kind of very related to this, that I think ideally the best way to issue any kind of public health directive, which could be in the form of a mask mandate, is through the Community Health Board statute authorizations in your capacity as the Community Health Board. And that provides for local ordinances to be enacted, but it's very specific that they're enacted through the enactment statute, which is a separate statute, 375.51, as opposed to 145A. So it makes it very specific that an ordinance could be established, but it has to have at a minimum 10 days notice, public hearing, that kind of thing. Very similar to what the city of Winona did in July of 2020, when Mayor Peterson at the time made a proclamation under 145A that there'd be a mask mandate in the city of Winona. And then at a later meeting in the July, during that July period, the Winona City Council affirmed his decision, which is really under the local emergency powers under 1229 of the statute. But the city of Winona has an ordinance or a city code that allows the city to really enact these more public health or health type of actions under the emergency powers. And I've researched the county's ordinances, of which there's about 45 of them, and there is no similar ordinance that that we have that is anything near. So what I was recommending, I think, in the communication to you in response to Commissioner Ward's question about the resolution was that it would probably be a good idea for the future, and if it's the immediate future, which I think is being proposed, that an ordinance be created. Now, there is also the powers that could be created under the local emergency, which the board is already under, but that would be a little more tenuous, I think. And as Commissioner Ward mentioned, it could cause somebody to potentially sue the board or sue the county, because there is no, like I said, comparable ordinance like the city of Winona had, because they use both the local emergency powers and their city ordinance, which really kind of tightens it well from a legal point of view. But I think looking at the emergency powers, and again, this is why I think one of the reasons that for the next item in terms of asking you to consider extending the local emergency is to have more flexibility, continue your authority to monitor this situation, to potentially establish, if necessary, emergency types of actions.
Do these have endings, or are these things that are ongoing forever when you put an ordinance in action? Does it have an ending, a beginning date and an ending date?
It can, if you establish it, and that's what the city did. The city of Winona established it, an end date basically until the state acted. And if you recall, then the governor issued his emergency order that created a statewide mask mandate. And then that took over from the city. And so that basically terminated itself. So, I mean, you have the power to say this will last until, whenever. And as we're recommending in this resolution, that the resolution adopt or continue the state of local emergency until you determine that you feel that it's safe to, say we don't need it
what
anymore.
we have in effect continues through September 1st.
Yes.
And you'll
more
probably
days or
see,
whatever.
you'll know if there's reason. Commissioner Olson?
Oh, so I understand Commissioner Jacobs. I mean, I've gotten several emails. People don't like these things, but some people don't. I understand. Commissioner Chair, or Board Chair, I understand your reluctance, but I also think that, as Commissioner Kavesi said, that we are the Public Health Board, and yep, there's going to be towns that are separated by borders, but I do think that we have to be a leader, and we're being asked. The CDC is recommending that we do this.
No, that's not a true statement. Everything the CDC and such is that they are recommendations.
They're recommending.
Nowhere in their language, if you can find it for me, I could not find in their language that we're supposed to put a mandate in. It is local control, yes, but it doesn't, I haven't seen in any publication with the CDC that says mandates. They are local, they are recommendations. and that. So
That
I
was
would go along
discussed-
if you
that
want to
was
put a, if
discussed
you
in
would
the
want to
shack
put a
meeting.
mask mandate on the city of Winona, because like Commissioner Jacob and my districts don't touch the city of Winona. We've got, different clientele, different constituents, and they have not been asking for this. I have not gotten one call, from another entity that has control to do this. This, like I said, the school boards are doing their thing. The cities can do their thing. The universities are doing their thing. The hospital can do their thing. Menards, any business can do their thing. Leave it open for people to make their own educated decisions based on their clientele and their customer needs. I just, again, and do we highly recommend it? Of course we do. But again, that's a individual's decision. And if you, again, as an individual, if you're concerned about, you want to use the word catching the virus, you can isolate yourself. You can wear the mask. You can control where you go and what people you interact with and stuff. But the general public is just not in the mood for mandates. And I think it'll be very unfortunate. And I think it would be, again, I said it before, I think you'll get less compliance and more pushback than if we just highly recommended it. And continue doing the education. We're spending $26,000 of taxpayer money to educate them to do these things. I think that's what the grant was. We're providing staff time to do these clinics on odd times in different locations. They're doing a tremendous job. We haven't cut any funding. We haven't cut any proposals. We're trying to make life better for everybody. And we haven't seen, as the statistics, it's 0.02. Yeah, you can say 8% of what's tested, but that's not the people. That's a percentage of what's tested. So again, and I had to think, and you talk about this resolution, I had to think, it's kind of like, I hate to say it, it's kind of like one of those fables, the little boy who cried wolf. If we keep crying wolf on everything that happens, and we haven't really seen as big of an uptick as you think is coming. So we keep crying wolf, and I think we lose credibility with constituents. If we don't have the right message and involve them, a public hearing, but a public hearing is after you've already crafted all the language, correct?
Right.
Yeah, okay. So again, I don't want to keep crying wolf to my constituents and not have a believable message. Fool me once, can you fool me twice? Like they're telling me I'm going to have a booster now. I'm just going by my own personal experience. And I went through the Mayo system, and I think, they're a pretty highly regarded, public health facility. Mr. Jacob.
I don't know if we're getting ahead of ourselves talking about the state of emergency, but it does seem like it either minimizes or somehow really diminishes the reality of the emergency. If we're perpetually in a state of emergency, what happens if something really big does come along and we're already in a state of emergency? We can't declare for public awareness, here's what's going on. We need to, I just feel like it's taken away from the value that brings community by staying perpetually in a state of emergency.
Can I speak on the emergency?
Yes, Ben, would you please speak on the state of emergency?
Okay, Ben, I will recognize you.
I think more goes into the emergency than masking. If we can, when we talk about the emergency, even forget about masking for a minute, because I do agree it's become way too political. And this is just for COVID-19. I'm asking for the emergency. If we have a flood tomorrow, we can declare another emergency for the flood. The emergency just unlocks some things for the county. It allows me to work through our emergency plan for mutual aid. We've used mutual aid a lot with the city of Winona and some other departments to provide over 30,000 vaccines to people. Those agreements we have in our emergency plan. It's allowed us to access over $100,000 FEMA funding. If there's no declared emergency, you can't touch FEMA funding. So that's the point of the
I would also,
I have to question that because I questioned a couple other counties, neighboring counties, and I got a different story.
Goodhue's declared one.
Okay, well, I talked to Olmsted and I talked to Fillmore and a couple of the other ones, and I got a different feel from them, that we're not denying working with our partners. We're not denying the number of vaccines available. Now, I don't know about the FEMA dollars, because that's, I mean, we're getting all this money for COVID-related things. Is that a separate pot of FEMA money you're referring to?
Yeah, that's under the emergency. It's a separate pot. So it covered funding for us back in March and April when that public health funding ran out. It covered $60,000 in staff time, and it's purchased a lot of the PPE we provided. More than likely, the KN95s you guys are wearing tonight was probably purchased with FEMA funding.
But does that have a cycle to it, that if so you're saying 100,000 for Winona County?
That's how much we've got reimbursed thus far. FEMA works on a reimbursement. So they don't have a pot of money per se, like Winona County has $500,000 or $100,000. You have to do qualified work for what they did. If it wasn't.
But what you're trying to tell me is if I don't do this declaration of extending the emergency, I can't submit bills to FEMA for COVID-19 related expenses?
After September 1st, no. So it would be no different than in a flood. You need to be under a declared emergency to get money to fix roads, to sandbag. There's two, the repair and the prevention. You need to have that declared emergency for that.
Yes, I was told different from other counties, so I don't know what to.
I'm here as your emergency management director.
Yeah, okay. You have that, is there a bulletin on that or something?
I believe you.
FEMA's good for sending out bulletins and updates and stuff. I mean, I have to, and again,
No,
being that I've gotten different information, I have to question.
No, you have to have the ongoing emergency status. To use your analogy, if there was a flood and it took a year, we would declare emergency and you'd keep it in place for that year while you're getting FEMA reimbursement. So it's the same thing with COVID. So some other thing comes along, you could delay.
From a federal level, the federal government hasn't declared FEMA gone. I mean, COVID gone. Aren't we still under federal?
Yeah, but yes. Well, FEMA's still providing reimbursement under a local emergency. And FEMA's the federal government, so.
Federal emergency too, but without us acknowledging that emergency, once we say our emergency's done, we no longer have access to the emergency funds. We no longer have an emergency.
And we have coordinated in the past, it was CARES funding with FEMA funding. So we, wanted to make sure that we could get FEMA reimbursement, and then we could do other things with CARES, depending on what needed to be done. It'd be the same thing with the American Rescue Plan money too.
I'll have to get clarity from my other resources. I apologize, but that.
I have a question because the issue of duration came up. Can you put a time when that can be re-examined, the emergency declaration can be re-examined?
Yeah, the board chair could set it that we re-examine it every 30 days, every time you meet, that can be set however you want. It doesn't just run forever. When we declared this one, we had no idea when the end was going to be, so it was just left open, but the county board can end it at any time. Even the one that's to September 1st, if you guys wanted to end that emergency today, you could. That's the power of the board to be able to do that.
Madam Chair, another reason for the emergency declaration, and I know we're jumping into that next agenda item, but it's important also from the point of view of the open meeting law. If the public body, which you are, declares a local emergency, which we are under and we have been under since March of 2020, we are then allowed to conduct meetings remotely, which helps the social distancing and all of the other preventative type of measures that I think are very important. And so I know that I've some people think, well, the state, terminated theirs, and so other entities in the county can't meet under open meeting law, but the statute says if the public body, and the county is the countywide public body, determines that the local emergency still exists for the reasons of a health pandemic, which this is, then other bodies can continue to meet remotely, which again promotes the preventative and the or trying to help contain the spread of the disease. So there's another practical point of it. So
Are you saying anyone can meet remotely, including the board, or outside of the board? Because doesn't statute regulate the board?
what I'm saying is that any body that's within the Winona County that operates within Winona County, for instance, the school board, I've gotten that question. And they didn't know that we still had the county emergency on. So they could continue to meet remotely, have a hybrid, whatever. I would say the city of Goodview could continue to do that if they wanted to.
This board can,
And this board can continue to do that under a local emergency. And as we've pointed out in the resolution, and I checked the CDC data tracker, we are still, yes, on high today. We're on high transmission, which is a serious situation. So.
Just to clarify, I know that we're kind of jumping here, but did you make a motion
No,
No,
would you like me to
We
make
have
a
no
motion?
motion.
on, but you were mentioned something?
Oh, so I would like to make a motion that we move forward with a potential change to our public health ordinance under 154A, 145A, as noted by the county attorney, to modify the ordinance in such a way that we could potentially implement a countywide mask mandate. And the order I understand is that we need to have language, and then it has to be noticed, and we have to have a public hearing.
And I would just ask that you clarify that, that it wouldn't be modifying the existing, it would be
Adding?
Establishing.
Establishing. Yeah.
I mean,
and
I'm not, again, this is your decision, not mine.
No,
So-
establishing, and
where
I
is-
would prefer that now, just to clarify, the city already had something in place that allowed them to make decisions in a more hasty fashion in the case of an emergency. And so rather than just have it be about a mask mandate, it is really that we're asking to be able to put something in place so that in any future situation where we needed to react quickly in a public health situation, we would have the potential to
Yes,
do that.
and that's what I would recommend if
And then
that's
if
what
we,
your
yeah,
wishes are.
and then if we get that in place, then we would make the decision about what we do with it, which could include a mask mandate.
So that's your motion?
Yeah, it was a long motion, wasn't
It's
it?
like
I'll second it.
I can't repeat it. It seems like a very overreaching, no ending, no continuity. I thought we were talking, so I heard tonight, we were all talking mask mandate. Now, with this motion, we're going into a total overall public health coverage. I guess I'm,
I
where are
don't,
we
I
going with
can't
this?
anticipate any public health crisis that might emerge. And
You want
with
the
board
ordinance
would
to
still,
cover it.
yeah, the board would still have to vote on it. So the language we will
But
see.
you have 3 days. Any board chair can call an emergency for 3 days without the board meeting.
That's correct. And then if
have that
you want to
flexibility,
continue
and
it,
then-
the rest of the board has to
Right.
affirm that or consent to it.
This is a thing that would require the majority of the board, not just the board chair, which I think is better.
But you're taking away, where's the authority for the board chair, the mayor, that position to do the 3-day thing? Are you taking that away?
No, I don't think so.
Well, and actually, what I had been referring to on the city code, it's section 2306, permits the mayor to promulgate necessary emergency regulations by proclamation, again, to the local emergency. And then, but then for it to continue. So it's codifying the local emergency statute in the sense of creating then whatever might be needed. And then so that the mayor, or in this case, the county board chair, takes the lead in terms of establishing a policy and then asking the rest of the board to follow suit. So.
And could it be written in such a way that it was the majority of the board that made this
I
decision?
think it could be written that, and again, you need to provide direction, I guess. But under 145A, there is, the inherent in that is to take actions as a community health board.
Yes.
To make decisions that could be seen as doing things that would prevent the spread of disease or carrying out your responsibilities as a community health
Well, my
board.
preference would be to see this as a majority of the board and not have it rest on the shoulders of just one person.
Can I just, I'm not trying to go either way here, but the reason that that's in place for the mayor or the board chair to take that action is it's in an emergency that takes place in an instant, or over a weekend or something like that, where a decision has to be made, and we may spend money, we may have to use manpower or staffing, whatever out there. It's not possible necessarily to get a consensus of the entire board at that time, or even get a quorum at that time. So that's in general why that's there. Could you craft something that kind of retained that ability, but still allowed the board to make, I don't know, but I'm just throwing it out there because it seems to me from a practical standpoint, because I've been in the situation before, where all of a sudden there's something you have to deal with right now. And you go to the board chair and you say, we need to deal with this right now.
The flood of '07 was
Yeah.
a prime example.
And you might be able to get everybody together in a day or two or three, but kind of hard to sometimes. So especially if people are out of town or something.
It's the form of an emergency regulation.
Yeah.
So that you don't have to use the 10-day notice period and all that.
Right, and then after the 3 days, the reason that's when the full board then, either concurs or kind of takes over. So I don't know how you want to kind of keep that ability somehow, but also address what you're trying to address. So I just want to throw it out there. I'm not trying to be a roadblock, but
Right, you're absolutely right. If you had a physical disaster where people couldn't come together, or weren't.
even a public health
Right.
situation, it could all of a sudden, if it's smallpox and it's, you have to close down everything, you have to cordon off. I mean, it's just you don't
reason
know.
for it.
You don't
Yeah.
really know, yeah.
Statute put that in there for some reason. What you're proposing, Attorney Sonneman, has other counties done this?
I'm not proposing it. I'm just saying that
You
the
are
law-
proposing it. It's
I'm
your
not.
proposal, right here. I drafted the proposed
the
resolution.
resolution to
Yes, so
continue
you
the local
proposed-
emergency,
Well,
which
that's-
is a recommendation from myself as well as my colleagues on
Yeah,
the
that's
command
something we
incident
want because of what Ben
team. Yes,
pointed out
as Ben
primarily.
pointed out. So.
I
Okay,
could
but
agree with that.
you're also proposing to change our whole ordinance, our
No, I am
public health.
proposing it, Madam Chair.
Well, under
I'm-
Attorney Sonneman's advice.
No,
Not
she
her
was
advice,
asked. She
not
was-
her advice.
Her opinion. She was
No.
asked her opinion
It's
on
an
it.
opinion.
I-
Yes,
I
it
was
was an
asked,
opinion.
is it possible?
Right,
And
so
I
that's an
said legally,
opinion.
there are ways to do this, yeah.
Okay. So my question is, have you got guidance from your statewide attorneys association? Have they approached this subject, and do they have boilerplate resolutions and such that
I have not approached my other colleagues as to whether.
and I know
there's
you
others.
often do in
I do,
things
but
like this.
I haven't had the time actually to do that.
Besides which, I'm
So-
asking for it now.
Well, it was somewhat put on the table prior to it. Commissioner Jacob.
Yeah, so for me to understand the motion and for the public to understand the motion, are we asking to change our ordinance, or are we asking to accelerate the speed at which we can enact a mandate on masks, or are we doing both? And will the public understand that immediately this is so this board can really, the government has more power. I think the citizenry set the government up thoughtfully in the past to not be able to move at the speed of lightning, so that they can be involved and bring their concerns. And we're saying, we're going to figure out a way to expedite all this, which to me defeats the real purpose of the democracy to begin with. So I'm struggling with all this and I don't even understand the motion.
So, Madam Chair?
Yes.
I'll try and
Commissioner
restate this a little more succinctly. I am asking that we, using our
So I'm sorry,
Our-
hold on 1 second. Are we talking 8.3? Are we off of 8.3, which was just an update, but it had options in it?
Yep, we're
Or are
talking
we
about
on
the
8
options.
Are we on 8.4?
Nope, we're on about the options.
Okay, you're talking about the 3 options.
Yep. So the option, is one potential offered idea is to implement a countywide mask mandate. In order to do that, one way to do it is because we are the Community Health Board and the state of Minnesota has created something, 145A, the Community Health Board statute. We have the ability to put an ordinance in place that would allow us to take immediate emergency action if needed. I would like to put that ordinance in place. Ultimately, I would like to use that to potentially put in a mask mandate, a countywide mask mandate. But this is not to do the mask mandate, it is to put the ordinance in place that would allow us to act quickly in the case of an emergency.
Madam Chair.
Commissioner Kavesi.
I've just written some things down, but one thing that jumped out at me is that actually what we're doing is we're asking to enact an ordinance to control the pandemic. So we're asking to enact an ordinance that would allow us to act quickly to control the pandemic, and then we can choose which ways we want to emphasize to control the pandemic. Is that clear? Does that make it any clearer? We're not asking to enact a mask mandate. We're asking to enact an ordinance that would allow us to address the pandemic quicker.
And it does say in reading your, the summary of Minnesota Statute 145A, a CHB, County Health Board, may authorize a city or county within its jurisdiction to carry out activities of a CHB. So we could tell the city of Winona, if you want a mask mandate in the city of Winona, go ahead. We give you our blessing. But maybe not a total county or the city of Goodview if they choose. If they approach us and they want us to do this, or any other city, obviously the school board doesn't need our permission. The universities don't need our permission. The businesses don't need our permission. I don't know what the churches or the religious institutions are going to do, but we can authorize them to do it if they want to do it, but we don't have to mandate it that it's on all the county municipalities.
Sure. As Community Health Board, if we enact a countywide mandate of some kind, typically we don't have authority over the cities or over the school board, but that clause that you just read means that as the Community Health Board, if we enact a mandate, then it applies to everybody.
Right.
Then they don't have a choice.
Right.
Right now they have, you're right, they have a choice.
So we would be taking away their independence to make their own decisions for their constituency.
Yes.
I just want to make that totally clear.
And if I could just, for the record, what the part of 145A that would allow you to establish a local ordinance is 145A.05 subdivision 1, which says a county board may adopt ordinances for all or a part of its jurisdiction to regulate actual or potential threats to the public health under this section and section 375.51, which is the enactment of ordinances. Unless the ordinances are preempted by, in conflict with or less restrictive than standards in state law or rule. So that is your enabling authority to do what.
So it's just like a zoning, they can't be less restrictive.
Right.
So if we say a mask mandate from the hours of noon to 6, they can't say a mask mandate from noon to 3. Because that would be less restrictive,
Right.
less time. Okay.
Yeah,
They all have to comply with the county unless we say they're exempt.
And we
We
could,
could say they're exempt, correct?
it says all or part of the jurisdiction. So
Right, so we could
you could pick.
exempt if somebody didn't want to be part of it. we could exempt. Commissioner Jacob.
so by part of the jurisdiction, we could propose a mask mandate on Commissioner Meyer's district, Commissioner Olson's district, and Commissioner Kavesi's district, but not on Commissioner Ward's district or my district. We could do that.
Technically, yes, under the literal reading of this, part of its jurisdiction.
Seems like a much more fair way to do it.
Madam
Commissioner
Chair,
Kavesi.
fair is one thing, but when you're dealing with a pandemic and a virus that is everywhere, I would like to deal with the virus
In Alba.
in the county.
Here's one you're going to have to research. Cannot or does not limit powers outlined in other laws.
Right, if there's something that, I mean, if there's some.
So
that
you already
trumps
said,
the-
right, because you already said the city of Winona has a different ordinance. Does their ordinance trump our ordinance? Does our ordinance
Well,
trump
their ordinance is a general ordinance that more encapsulates what the emergency powers of 12.29.
That's what we're kind of talking about.
Well, not in, I mean, you can create any kind of ordinance that as long as it's within the, to regulate actual or potential threats to the public health. Under the Community Health Board statute 145A.
I'm going to make a motion to amend Commissioner Meyer's motion to change from a county-wide mask mandate to a mask mandate that does not include the 3rd district and the 5th district.
Madam Chair, just to be clear, I'm not asking for the mandate. I'm asking for an ordinance change that could make a mandate possible.
Okay. I did ask for that clarification. I thought it was both.
Nope. I later would want to do a mass mandate, but right now I'm asking for the underlying ordinance to be established that would make it possible.
A question so the public can follow this. On our newly designed website, where is our public health ordinances listed?
Well,
That are that we currently operate
oh,
on?
all of our ordinances are listed. It's on
But
the
is it-
board agenda page, on the board page, there's agendas, meeting minutes, and then ordinances.
I will find it on.
Well, that's the ordinance,
Public health.
that's the ordinances the board has passed, the
Passed.
45 ordinances or so that
Okay,
Karen
all right.
mentioned.
There are 45, but there's not any real, I mean.
There's no,
There's public health about vending machines
Right.
and things
Right,
like, you know,
we
but
really don't have.
there's not any specific, I mean, there's nothing about communicable diseases.
We're kind of
or
going
anything
into
like that.
uncharted ordinances.
well, the reason
for us.
we don't have one, so that's the
Right,
reason that
right.
it's being
Right,
yeah.
suggested.
But I should be able to research some other counties and see if they have anything, if they publish them. on
They publish them, right. Mhm.
All right, so we have a motion to pursue the language for an ordinance, public health ordinance to restrict.
It would make
or
it
to
possible.
Enact in public emergencies.
Yes.
A second.
I second it.
Oh, well, we hadn't, I'm sorry, I didn't realize that we hadn't got clarification. Okay, any other discussion? Commissioner
You-
Jacob.
You had a number of questions there with respect to it. Do you feel like you're clear on crystal clear on all your questions?
I think the public hearing will be critical because I think the public needs to weigh in. And I think I will continue my list of questions. Yes.
I'm having a hard time getting I should be quicker than I am getting a grip on exactly what's being proposed here. And I think I'd like more time to review this, so I'll make a motion to table this.
I can second that. But now, parliamentary procedure. We have a motion and a second to move ahead. We have a motion to table.
That's
Right.
That's correct procedure.
So we vote on the table first? I just want
to check the process here, sorry. To lay it on the table, a second's required, yes, debatable, no, amendable, no, vote required, majority.
So we vote on the table first before the other motion?
Once it's been made to table, I believe
Okay,
so.
all right, so we're going to vote on the table. All those in favor say aye.
Aye.
Opposed, nay?
Nay.
Okay, it fails. All right, so now we have Commissioner Meyer motion with Commissioner Olson seconding it. Any further discussion?
Can you restate the motion? Can you restate the motion?
Oh, can I?
Not just for me, but for the public.
Yeah, I can attempt to. I guess it's directing staff to propose a
No,
county,
not propose.
Craft an ordinance.
well, it's a proposed ordinance because it's not passed or anything. So it would be a proposed ordinance to
Community health
to
statute.
follow community health emergency situation statute.
That would allow us to make certain emergency decisions to protect the county.
Are we ready to vote? I will ask a question before we vote. Looking at my sheet of summary of cannot neglect to enforce. So if we're going down a mask mandate or any other public health, lock them up, weld the door shut type of thing, we have to have enforcement built into the ordinance, correct?
Correct. Well, what I can say is when the state created its mask mandate,
But this is much more than just a mask mandate. This is a whole public health emergency.
Okay, public
thing.
health emergency, it depends on what then the board acts on after, if this passes through the public hearing process and what you're enacting.
But an ordinance would have a penalty.
It's a misdemeanor.
Enforcement.
It's generally a misdemeanor.
All right, are we ready to vote? All those in favor say aye.
Aye.
All those opposed, nay.
Nay.
So do we set the 10 days for a public hearing now?
You have to have the ordinance coming out before you set the 10 days.
Be longer than 10 days.
Okay. All right. Okay, item 8.5, discuss and provide direction for.
8-4.
Oh,
8-4.
oh, okay, 8.4, discuss, approve, deny extending COVID-19 local emergency resolution.
Ben, could you come back up? As our emergency management director, what would be a reasonable timeline for an extension?
I would think 60 days would be appropriate, just looking at what public health was talking about, how long the spike could be, and also looking at the fact that booster shots look like they're coming in the next month or so. Under the emergency, we provided a lot of our vaccine clinics and stuff the last time, so I think 60 days and then review would be reasonable.
Yeah. We've had this before us. It was coming to an end. We've extended it. Now we're looking at extending it again. It seems if we're into this 18 months that to revisit it every 60, I'm going to suggest if we're going to do it, to do it no less than quarterly, every 90 days. I mean, it just seems like it's coming, it's sending mixed signals. We're going to have it, we're not having it, it's ending, it's starting. Where are we? People don't, are we in an emergency? So, I don't know.
That could be a motion?
No, I'm not making a motion. I'm just suggesting that this is, I mean, it's like our foot is on the gas, it's on the brake, and the community doesn't know what direction we're going.
I'll make a motion, we extend it 90 days. Per Steve's, Commissioner Jacobs' suggestion.
I would second that.
Well, we're already to September. Are we abolishing that one and creating a new one?
What the motion is, but I would suggest making it from September.
No, 90 days from September 1st.
September 1st.
90 business days, calendar days.
Days.
Well, there's technicalities.
Days.
Calendar.
Straight.
A 5-day working week is a whole lot different than a
Oh, so
calendar.
maybe rather than 90 days, it should just be till January 1st?
End of the year.
December
January
31st?
Yeah.
I was just trying to get some buy-in.
I know. I appreciate that. That was a good job.
I'm trying to read at I'm still puzzled on this FEMA dollars. I'm trying to read part of this, and here it's saying the governor must appropriate action.
Oh,
state
Madam
law,
Chair,
and-
okay, so
and
did
stuff.
you go to that training? Ben gave us this emergency, yeah, there was this emergency training. What I remember from that training is if we declare an emergency, and let's say it's a flood, then the amount that we can get reimbursed is some percentage of what the total damage is. But if the
Right.
state also declares it's an
It's different.
emergency, then it goes much higher.
Right.
So,
Not to muddy the waters, but this one is different because the
Yeah.
federal government is covering this 100.
yes, but still,
Instead of the normal 75.
Right,
Yeah.
'cause it talks about the president, it talks about the governor, and I'm just trying to get clarity because this is not clear.
but still, what I recall from that was that we need to do it, and then certain other agencies or levels of government above us can do it, but that also really helps us. So,
It's very small print, so I'll read it later when I can.
yeah, and it's a very small screen.
Very small screen. Okay, so we have a motion to extend the COVID-19 state of local emergency for 90 days. Is that what the motion was? And that was made by Commissioner Olson, seconded by Commissioner Meyer?
No,
Or
Commissioner
Kvesi?
Kvesi.
Commissioner Kvesi. Any further discussion? All those in favor say aye.
Aye.
Opposed, nay? Nay.
I would like to thank Rochelle, and I'm sorry, I didn't catch your name from Gunderson, but Lindsay, thank you very much for coming. And Ben.
Now we're into discuss and provide direction for the upcoming county administrator vacancy. We took this off the table last time.
I don't think we can conduct business without Greg
Oh,
here.
yeah, and it's 9:45.
Is it really that late?
It's all pretty straight. Yeah, it's all pretty, it's all pretty straightforward. Is there something that we need to change, or, if somebody wants to change something? Is that what you're looking for, Ms. Hulte?
Yes. So the first part is to determine whether or not the desired changes to eight. So what that entails are the roles and responsibilities, and this is basically right out of the statute. So that is the first part, and then the second part is to get insight on how you would like to handle the process moving forward. If I can just cut to the chase, I'd recommend that we use an external entity, as you have in the past. I think it is best for the overall outcome.
Commissioner Jacob?
Yeah, I felt like last time we used through David Drown and Associates, thought they were very thorough, very fair. It made took out any potential conflicts of interest. It seemed like the right way to do it, and I would support that. I would support that same process and go as far as to, I don't know if we have to put that out for any type of bid, but I was certainly happy with how the David Drown and Associates handled things last time.
Well, I would like to see a competitive audience for doing that work, because they're, they do a lot of county stuff, but I've also seen some, maybe what I don't feel is as positive. They kind of have a pool of candidates, and they kind of move that pool around because they do a lot of county work. Now, we're currently, I'm sitting on, MCIT, and we're looking for a new executive director. And we did not use a search. Of course, it's in Minneapolis. We did not use a search agent or anything. I'm not sure how many applicants that we are in the interview process. We're going to do interviews like in early October. But I don't want to just give the contract to David Drown. I want to see somebody else put something on the table as far as what they do and check their references too and stuff.
So would your proposal, could we put together some options for you to consider and bring it back to the future meeting?
I'm okay with that. Do we need to do a motion, or can we just do it by consent? I mean, I'm okay with that.
I'm merely asking for direction.
Sure, yeah.
I don't need a motion, because I just really need to know what you want me to do, so that we can get it before you, and then you can decide what you want to do as a.
Well, the options, the top option, conduct full executive search.
Yeah.
That's what that seems like the best option to me.
Yeah, okay. Yeah. All right, that's what you needed?
Yes, Madam Chair, am I to understand there are no changes to classification then?
I don't have any.
I didn't see anything. I would
Pretty
like them to
broad.
be able
Ken,
to-
what would you've been sitting in the job for 6 years. What would you change in this?
We wrote it.
Yeah.
I would like them to be able to lift 3 more pounds.
Yeah, 3
Yeah.
more pounds.
Yeah.
Good luck with that.
They need to dance.
Yeah.
And sing and dance.
No, we actually did collaborate on this a while ago.
You went
so,
through it.
Yeah.
Yeah, you updated it. It
Right.
changed some verbiage.
Yeah.
And stuff. Okay, all right.
Will the goal be to try to get someone in place before Ken's last day?
That'd be my preference.
Sounds good.
Well, but, okay, then you're paying, a lot of times you're paying double wages. And in the past, we've tried to not pay double wages. They leave, the new person comes in.
I'd like to just let the process play out. And if it takes longer, it takes longer. To have an assistant county administrator, I know you don't relish any extra, work in the interim, but I wouldn't want to.
We don't need to, yeah, we're not under.
But we do want to start.
Yeah,
You
I
don't
think
want to
I
wait.
think we just start the
You don't wait
process
till
and
after the first of the year and then start.
If we end up with it, without a full county administrator for 30 days, we do have an assistant county administrator.
And
who's
staff.
have been very competent.
But we do want to start now.
Yeah,
I think
Getting
we start
our act
process.
together.
Yeah, because
is
it
what we're
takes
gonna
a minimum a couple months.
Yeah, and if you would start to put together language about a bid, would there need to be a timeline in that bid, or is that?
We haven't done bids in the past. We just did the research, and Ms. Sonneman, you could concur.
Yeah, I mean, we worked together on that and put out.
Well, we
Well,
could,
how
we
are
could
we
just
gonna-
ask AMC, who does,
Yeah,
Yeah.
so
Who does-
you
who
can provide
does-
us with
Right,
several
but
quotes.
we
There-
don't
there's
have
a
to have a
couple firms.
timeline in
Yeah.
the
No.
background information.
who's active
for
in
that,
Minnesota
okay.
as far as recruiting administrators?
Yeah.
And they probably got a, a list of names that we can ask, and how they've done it in the past.
Okay.
Yeah, we'll just collect information, bring it back to you to discuss and consider at the next meeting.
But to Commissioner Kavesi's, you don't want to drag it out too long, because if somebody's going to put their name in for it, they don't want their current employer to find out. So it has to be a kind of a tight, once you do take applications, kind of a tight time frame.
Yep.
And they know that. It's the people who you don't hire that may be in jeopardy of,
Right, when the information comes back to us, they would have a timeline.
Right.
And that's part of our deliberation. But I just wondered, did we have to give them a timeline of where we
No.
were looking on that? So if we don't, then we're okay.
Well,
Because
Ken
we don't have a
Did you
timeline.
really say January or December, January 31st. I think.
No, it's December 28th.
Good try.
Gotta
Our-
pass the budget and
I-
the
Our last
board
property
I
tax
said I
budget.
didn't accept the letter.
Yeah.
Okay. I didn't accept it. All right. Is that what you needed, Ms. Holte? All right, thank you. All right, 8.6, approve, deny future agenda item to discuss dog breeding ordinance. And Commissioner Olson, you
Well, I'd ask for this to be on the agenda, so I think tonight we would need a majority vote to bring it to a future agenda item. So I could do so in a motion that we would bring a future agenda item to discuss the dog breeding ordinance.
I second that.
Okay, we have a motion by Commissioner Olson, seconded by Commissioner Kavesi to move forward in our process, the discussion on dog breeding ordinance. Any further discussion? Just from the way the discussion went with the last one, I think there's some clearing up that needs to be done as to how we interact with the state and the federal on these permits and everything. It was confusing both to the applicant. I think the applicant was confused. Maybe staff wasn't as clear as where we were on all that. And then what was in the file from his, his previous thing. So I guess some, clarity and some maybe checklists and such would be in order.
Yeah, I can support a discussion. I'm not saying that I'm supporting where things go.
Right. Discussion would be.
Mm.
All right. Any other discussion?
Discussion.
Okay. All those in favor of moving it into a discussion phase? Say aye.
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 Aye. Opposed, nay? Okay, we'll put it on a future agenda. Okay, let's see. Commissioner Meyer, we've had committee and a board action.
Oh, yes, committee. So Commissioner Olson and I are both on the Joint Airport Zoning Board, and the airport zoning ordinance got updated. I don't know, when was it, like from the 40s? For goodness sakes, it'd been a long time.
That recent.
And we just we met this week. There was a public hearing, and we just met this week to then approve the final ordinance. MnDOT approved it, and it's all set to go.
Are they expanding the airport and the services they provide, or is it?
No, I don't know. In fact, I think they have less runways than they had back then, but the laws have changed, and the ordinance was out of compliance.
And you had a future board action?
I'm gonna skip that for now.
Okay, all right. Commissioner Jacob.
Yes, upcoming event. This week, there are festivities in St. Charles for Gladiola stays throughout the week, and then the grand parade on Sunday. So don't want to miss that. And then the future board item is I met with Dave Kramer, Kyle Lake, who we've had some correspondence with, on taking an improved surface on Highway 74 and removing that surface. So we met with Steve Dreskowski and Dave Kramer and myself. But so in that, I started circulating a petition that this road would be basically treated similarly to all the other highways throughout the state, and that they wouldn't revert it back to crushed rock, and they would put a similar surface on it as what they had previously. When I opened that petition, I immediately got 400 signatures, and I'll continue to circulate that throughout my community, hopefully get thousands of signatures on that. But I might be looking for the board to perhaps discuss and draft some type of resolution to support this highway being treated similarly to
State highway.
Yeah,
it's not a county
the state highway,
it's a state highway.
to how they treat them in neighboring counties and throughout the state. So that's the item that I'd like to discuss in the future.
I'd second that.
All right. Put that on for future. Commissioner G. Jacob making the motion and Commissioner Meyer seconding it. All those in favor of?
No, this is, we're not that far yet.
We'll do that
Well,
next
to
meeting.
Yeah,
We do that next meeting.
that's right.
One step at a time.
One step at a time.
Always have.
Let's see, did anybody else have anything else for the good of the Winona County Board? Not, we're adjourned.
Welcome to adjourn.
I'll second.
I've been told I don't need a motion, but I'll take it.
I know.
Motion made, second. All in favor, say aye.
Aye.
Opposed, nay. We're adjourned.
That's, like I said, that's the only one in the state that, right?